Okay, all right. Thank you, everyone, for joining. It's great to see everyone here. Um, yeah, um, few people in the chat and already talking. So, thanks everyone for coming in. Today is just my Friday Australian and Thursday evening American live. So I try to do these every week. Next couple of weeks I'll be traveling, but I'll still try to keep to around the same schedule if I can. But next week I'll be at a conference. I'll actually be speaking at a summit on metabolic health in San Diego next week. So that's for people who are going to that or people who want to go to that. There'll be 4 days of talks, which will be very, very interesting. I think it'll be fantastic. So the first day on the 17th is when I'll be speaking. Yeah, it'll be 4 days of talks. I'll be speaking on the first day and the last day. There's a whole day just dedicated to cancer, and so I'll be giving a talk on glioblastoma brain cancers, and how we can some of the evidence for how we can address these by metabolic approaches, in addition to standard of care chemo, radiation, surgery, things like that. And so, yeah, so people that are in the San Diego area or interested in that sort of thing, that's where I'll be. But in any case, we're here today. Wanted to start out with some of the questions that I put up. So people that were, subscribed to me and saw my post announcing this on YouTube, asked them to submit some questions. And so when I do these things, you can put your questions there, and we'll start with those. So just to get to a couple of those questions, and then we'll get into the questions in the chat. First question says, I'm a 39-year young female and I've been carnivore for 1 month and would like to hear your advice. Unfortunately, I'm having multiple chronic sicknesses, irritable bowel syndrome, sliding hiatus hernia, lipedema stage 1, premenstrual dysphoric disorder, rosacea, and very painful energy draining fibromyalgia for almost 8 years. Thank you for your answer. It will help me do carnivore the right way. So I think what you're asking there is this going to help? And I think yes, it will. And but with anyone with any sort of issues like you're discussing, it's really important to be as strict as possible. Any any sort of outside foods, they're going to potentially cause a bit of inflammation, irritation, and problems. So if you are just paring it down to just meat and water, even avoiding things like dairy, especially from milk, I think you'll be better off. And most people do the best on red meat as well. So, try that. If you're not having the results that you want, or it's not coming as fast as you would like, just try to switch down to only meat, only water, and remember to get enough fat and enough food. In general, your body needs food. And so you just want to give it the right food. All right. So I would give that a try, but yeah, you'll definitely get better. A lot of those issues can certainly be helped by eating a proper diet and letting your body get on with it. The hiatus hernia, that's not going to fix itself, but a lot of people find that they are much less symptomatic with the hiatus hernia. Hiatus hernia is a anatomical defect that's there from birth, and so that's not going to repair itself. But there are a lot of people that find they get a lot of relief from the symptoms that they have, like really bad reflux symptoms. So I would expect that to improve as well from a symptomatic point of view. Okay, question from D. Lee. Question says, hi, doctor. Is it important for us to have the test that shows soft and hard plaque buildup? My mother died at 56 and father both had heart attacks. I'm so sorry to hear that. And this person is a 64-year-old female. Well, it just depends. It depends on your risk factors. It depends on how you are feeling. If it's something just for your own interest, then you can certainly do that. If you have other risk factors, if you've been a long-term smoker or obviously family history, that may be something that you might want to do. If you're getting symptomatic, you're getting symptoms of angina, so you're getting that sort of tightness, pain, shortness of breath on exertion, then that's something you certainly need to get seen for and do a stress test and possibly get an angiogram for if something comes back positive or worrisome. But if you're completely fine, you have no symptoms or anything like that, and your doctor's not worried about it, then academically you could check that out, and then you could check that again in a year or two on carnivore and see if there's improvement, or if God forbid it gets worse. At least it gives you some data points and lets you know you're on the right track, or maybe you need to rethink this whole crazy carnivore thing. But people who have done that, they get better, and people are getting improvement in their personal experiences. Dr. Sean O'Mara has actually shown that doing different sorts of interventions, reducing visceral fat, best way of doing that in his words is a carnivore diet and sprinting, and which is the best sort of exercise for that. Also, resistance training to muscle fatigue is also very, very good. So those two things, and the exercise standpoint, as well as eating a proper diet, he's found that that's the best way to reverse and reduce visceral fat, which is very, very, very important. And he has shown in his research that people have actually reversed their blockages in their brain, which is pretty crazy to think about. But yes, so that's something you could do if you were interested in it, and you could check it again later on. But if you're feeling fine, it's sort of academic at that point. If you're symptomatic, then yes, you definitely need to get checked out. But for me, I haven't really worried too much about that, because for my own personal self, just because I'm not symptomatic, I don't have any of those issues. I've never really smoked or drank or anything like that. And I mean, I did, like in high school and things like that. I drank more in high school than I have as an adult. But that's been a long time since I've done any of that stuff. And as a kid, you're a teenager, you just go and sneak a couple cigarettes or something like that behind school. That was it, really. I've never been a smoker. So without those risk factors, I'm not too worried about it. And I'm convinced in myself that I'm not going to do anything with that information. I'm not going to, if I have some blockages, I'm convinced in myself that doing what I'm doing will continue to improve that from wherever I was. And so I'm fine. If I start getting symptoms of something, sure, I'll go get checked out. But I'm not one to get a whole bunch of tests just because. I don't think that you necessarily need to get a well baby check every year, every few months. Sometimes whatever, just to check. I might do. I've done my bloods 3 years ago after sort of 2.5 years on a carnivore diet, back on a strict carnivore diet, basically just to prove to other people that this was not a crazy idea. And that actually convinced a lot of my friends who were doctors, because my blood tests were so good. I haven't made a video about those just because I didn't care to. And at this point, it's sort of 3 years past, so I might just get a new set of bloods at some point to do it. But that's literally the only reason I would consider, for myself, getting these blood tests if I'm not actually worried about something. So that's how I think about that. Just do a super chat here. Thank you very much, Ryan. I appreciate it. Ryan says he's 6 weeks carnivore and so many benefits, but his multiple sclerosis symptoms are in turbo mode. Oh, that's not very good. Any thoughts as to why? Eating 85% beef with eggs, bacon, rarely cheese and cream. Relapse started 1 month before diet change. Much worse now. Okay. So MS is one of those things that it damages the axons of your nerves, right? So it damages the myelination, and that can cause problems. That can get better before it gets, or that can get worse before it gets better, and it takes time to heal. You need to be especially careful. Anyone with autoimmune issues needs to be especially careful with what you're eating. So you're eating 85% beef, which is great, but you're also eating eggs, bacon, some cheese, some cream, though rarely. I think you need to get rid of that. I think that you really need to just get down to just beef. People with autoimmune issues are even sensitive to animal products, to other meat, and especially dairy and eggs. And I think that has a lot to do with what the animal is being fed. They're not eating what they're supposed to eat. They're not necessarily as healthy as they could be for us as well. The animals, more healthy the animal is, more healthy they are for us, and the more healthy we will be as well. I think for most people, it doesn't make much of a difference. I don't get sensitive to the sort of chicken, pork, or even dairy. I don't have a problem with that, but I always feel better on beef, just myself. But there are people that have autoimmune issues. You really need to be careful about what you eat. You need to be just on red meat. So I would just change that, and I would just go strict beef and lamb if you like that, and water, and that's it. And I wouldn't use any spices, any seasonings. A bit of salt if you want it. I don't even use salt anymore. That's something that that I've just used less and less. It's purely from a taste perspective. I don't like a bunch of salt now, and now I actually prefer just meat on its own with no salt, and that's just my flavor. So salt to taste. Right now I'm salting to taste, which is zero salt, and so that's what I would do with you as well. Just go beef and lamb, and stick to that, because that's going to give you the best results that you can get. And then it just takes time, right? Because your axons have to remyelinate, and they have to repair the damage. And I don't know studies that look at this, but I've seen individual patients who have improved dramatically on all autoimmune issues, but specifically in multiple sclerosis, who not only improve symptomatically, but on their MRIs, they have been healing those lesions. So that's really hopeful, and that's really fantastic that they're able to do that. I think you will absolutely be in that category as well, as long as you are very strict. You need to be strict. You need to be more strict than other people. And so I think go for the next 3 months, just beef and lamb, only water. No drinks, no milk, no dairy, no eggs, no anything else. Fatty beef, fatty lamb, only water. That's it. I think you'll find that you improve dramatically if you do that. So thank you for that. And if you do have a question, guys, just put a Q in front of it, or write questions so I can pick it out of the chat. And so we'll go from that. There was a mention here also with Dr. Idson, Seventh Day Adventist. I've actually spoken to him since then. He's not a Seventh Day Adventist himself, but he is a lifestyle medicine practitioner, which is started, run, and orchestrated by the Seventh Day Adventists, and that is their MO is veganism. Get rid of meat. Not even that plants are better. It's just meat is evil. Meat is bad. Meat is toxic. Meat is a toxin and a drug, just like alcohol and tobacco and all that sort of stuff. But having spoken to him, he's saying he had absolutely no idea about that connection. I would tend to believe him. I don't see why he'd have any reason to make that up. But he obviously has been, is a member of the the lifestyle medicine sort of group. But he could be just sort of another victim of circumstance of these people just trying to influence other doctors and things like that. But yeah, he definitely does push a plants are better sort of message, and that is right in line with the lifestyle medicine sort of thing. So it could be that he was sort of thinking that as well, and then he went in and so said, "Oh, lifestyle medicine sounds like the right thing to do." But it is, lifestyle medicine is absolutely run by the Seventh Day Adventists, who are religiously anti-meat, and they are influencing a lot of people, sometimes unbeknownst to them, which is pretty devious, and that's why we have to just make people aware. And so you see that. So someone says lifestyle medicine, you have to sort of ask that question: are you being influenced? Yes, you are. If you've been taught this sort of stuff, you're going to be influenced by their teachings. But are you a member? Are you have you fully drank the Kool-Aid, and you're full on board with this sort of idea that meat is evil? Or have you just been influenced by the people who say that meat is evil? So that's just sort of the questions you have to ask. So here's a question. What do you think about coffee enemas? This sort of actually reminds me of the Seventh Day Adventist, because Dr. Kellogg's, who was a Seventh Day Adventist, he and his brother founded Kellogg's Foods and Kellogg's Cornflakes. The guy was massively into enemas. He would give himself 2 enemas a day, and that was his call. But he was big into those. I don't know if he did coffee enemas. Speaking with some people, they have mentioned to me that there actually is some good evidence for certain things for coffee enemas. I haven't looked at the data myself. I haven't looked into that much on my own. But it's interesting. I think the thing is like, what are you treating? Is there something that a coffee enema specifically treats? Okay, and then you look at the evidence for that. I haven't really come across too many things that, switching to a carnivore diet and eliminating out plants and fiber and eating more fatty meat and especially to get rid of constipation, a lot more fat, what that can't solve. So I haven't come across something that I'm really stumped. I'm like, we need to think of something else, maybe a coffee enema. So I haven't come across anything that I'm looking for a solution for in that regard. But I've heard people talk about them, but I haven't seen the data myself. And another question here from B. Dear doctor, why normal body fat percentage but high BMI? Not a bodybuilder or lots of muscle? So I don't know if this is directed towards yourself or for me. I have a lower body fat percentage. Usually when I'm not working out, I'm just sort of sedentary as I normally am with work. I'm usually around 10% body fat. When I'm lifting weights, I go down about 6% body fat. The funny thing there is too, my body fat percentage goes down, my weight goes up because my musculature goes up, and so my BMI goes up. And so even though I'm more fit, more healthy, I'm worse off. So I'm right on that cusp of being obese at 10% body fat, just because for my height and weight, I'm just over that threshold for being obese on the BMI scale. So that's the thing. BMI isn't a great metric. It's maybe okay for populations, sort of looking at trends, but even then, it's not all that great. Height to waist circumference is a better population wide and moving towards being better in individual sort of metric. For someone just in the clinic doing a quick rough thing, can't do scans, can't do any sort of metabolic tests, it's a little better. It's better than BMI, certainly. BMI does not take into account musculature or metabolic health. The waist circumference thing is good because you're sort of looking at your central adiposity and potentially your visceral fat. If your gut's sort of just sticking out there, you're going to have a lot of visceral fat, not just subcutaneous fat. It's the visceral fat that is metabolically active and quite harmful. So that's what you don't want. However, you can have the same waist circumference and have very different amounts of visceral fat as well. And so that's not a perfect metric either. Right. So, you can have a lot of people with different BMIs and different amounts of visceral fat and the same waist circumference. So that's why I go waist circumference to height, first of all, but also you just, again, with the visceral fat, you just don't know. You don't know if there's going to be more or less visceral fat there just by the waist circumference, but it's moving in the direction of being a better way of measuring these things, but it's not great. So I tend to not worry about BMI much, and unless you're talking about the extremes of things, someone's a BMI 9, you're like, oh my God, okay, that's likely to be dangerously skinny starvation sort of issue. Or BMI 68, you're like, okay, well, that person is going to be very overweight, like with fat, because even like the Mr. Olympians, they're going to be morbidly obese by the BMI scale, but those are few and far between. If you have someone who's massively elevated BMI, it's more likely to be that it's because of a lot of extra excess fat tissue and things like that. So, okay, we get to some. Oh, sorry, we'll get to some of the super chats here. So, thank you very much, Scar and Thor's mom. Question is, my 3-year-old son has large tonsils, snores, and sometimes wakes up when sleeping. Will carnivore help shrink it? Don't want to take them out unless needed. Hard to say. It will reduce a lot of issues. It will reduce a lot of inflammation. A lot of adults stop snoring within a week of doing a carnivore diet, and they're removing a lot of inflammation. You get fat sort of stuck in the tongue and in the soft palate, and potentially could inflame the tonsils as well, and that could cause problems with the airway, obviously. Um, so I would absolutely imagine that it would help that, and um, and would help in a lot of other ways as well, especially developmentally. If you're eating the right things as a kid, your body's going to develop properly. Your airways are going to develop more properly. Your palate, soft palate, hard palate, they're all going to develop more appropriately, especially when you're eating the right density of food, which is meat. So not having this little mashed up pureed sort of stuff after 3 years old, he can start eating more solid things, giving him a chunk and then letting them, bite off chunks and things like that to their ability. That's something that, people sometimes do. You can look up the exact technique, but basically the sort of self-directed sort of eating where they have a big chunk of meat, smaller pieces that can be a choking hazard, but bigger pieces, they only sort of bite off, rip off bites that are big enough or small enough for them to contend with. And it's also very good for the jaw and palate development to be chewing like that and chewing that consistency of food. This is what we're supposed to do. And when you're having airway issues, you're more likely to breathe through your mouth in general, and you actually change the development of your face. Your facial features and structures actually change. You get this sort of adenoid appearance, much longer, flatter cheekbones, sort of this drawn out sort of look in your face. Instead of breathing through your nose, everything tightens up, your jaw tightens up, your jawline pops out, your cheekbones start popping up, and it can actually physically change the structure of their face. So, while they're having these airway issues, they may not be able to breathe through their nose. So you want to address those things with diet. It's going to help them in 1,000 other ways as well, especially when they're 3. They're going to have massive improvements in their development. And they're also going to be able to breathe through their nose better. Then you want to encourage that nasal breathing during the day and at night as well. It's very important to get that nasal breathing. It's something that most people have airway issues, clogged up faces and everything like that. And so they just breathe through their mouth, and it actually changes our development, and it's not great. So that will make a big difference for them. Okay. Bamboo Pandolfi. Good name. Thank you very much for the super chat. Hey, Doc, previously on a live, you mentioned not eating during the day and eating at night. Conventionally, I've been told to time my last meal a few hours prior to bed. Does that still apply to carnivore? It's whatever you feel best doing. Some people feel better and sleep better when they eat a large fatty meal just before bed. I'm one of them. It naturally makes me calm, relaxed, and sleepy. A lot of blood going to the digestive system. It's not there in your brain and your muscles to keep you active and want to go play. And it kicks on your rest and digest mode, your parasympathetic, so that you sort of just calm down and relax and chill out. And for me, that works great for going to sleep. Conventionally, people say, yeah, you don't want to eat that close to your meals. And I think if you're eating a normal diet with a bunch of carbohydrates and things like that, this can be an issue, because carbohydrates raise insulin. Obviously, insulin disrupts a lot of other hormones. So insulin's a hormone. It disrupts a lot of other hormones as well, like growth hormone. Growth hormone is secreted every sort of 60 minutes in men, 90 minutes in women, but maximally it comes out at night after we go to sleep. And insulin blocks the secretion and action of growth hormone. And so if you're eating and you have this big insulin spike right before you go to bed, then you're going to miss out on that. You're not going to get as big of a hit of growth hormone, and it's not going to be as active, right? So I think that's a problem. It also interferes with melatonin as well. Insulin does, and melatonin interferes with insulin. So there are a lot of cross reactions with these hormones, and they all have very, very intricate interactions with each other. And so I would just be mindful of that. But when you're on a carnivore diet, no, you don't have that issue. And so I think that it's really just a matter of preference at that point for you. For me, I prefer doing it later in the day because I get, if I eat a big meal early on, then I will feel sleepy in the middle of the day or in the morning, and that's not what I want when I'm busy with work. Super chat from Rachel. Thank you so much for that. There's no question attached, but maybe there is one somewhere. If there is, please put that up and put a big question on it so I can pick it out in the chat. Super chat from Marilyn. Thank you very much for that. She says, stent in Widowmaker in 2009, clear angioplasty 5 years ago. Great. I want off statins. Good idea or no? That is, I can't really give direct medical advice, over the internet. I don't know your whole story, and I'm not a cardiologist, but that is something that you can talk with your doctor about and make an informed decision. You can look at the different works and the different information on cholesterol in general and how that relates to heart disease. So I did a video called "The Truth About Cholesterol and Heart Disease," and that goes through a lot of the literature. One thing to understand about statins is that they don't lower the small dense LDL cholesterol, which are more strongly correlated with heart disease and stroke and things like that. They don't lower that. They stop your body from making the large buoyant LDL cholesterol molecules that are actually good for you. So even a lot of people that contend that statins are of net benefit, a lot of them are saying, yeah, it's not because of the cholesterol lowering mechanism. It's probably something else, like an anti-inflammatory sort of thing. So things aren't clotting as much. Like, aspirin does that as well, and that's why we use that. And so, is that giving much more benefit on top of aspirin? I don't know. But Dr. Asima Holtra is a cardiologist in the UK. He wrote a book called A Statin-Free Life, and he goes into a lot of the literature and data on that. And something that he was saying was that, statins, if you have had a heart attack, 1 in sort of 84, I think was the number, will benefit from getting a statin, but not much. It's like if you've had a heart attack and you've been on a statin for 5 years, on average, it'll increase your life expectancy by 5 days. So days, not weeks or years. And if you haven't had a heart attack, it's really negligible. It doesn't really extend life. It's maybe 3 days. So that's what the data shows from the industry research, from the statin manufacturers' research. So it's probably worse than that, right? But their own literature, the best that it can possibly be, is not all that great. And then you have all this expense. You do have side effects, and is that what you want? And do you think that that's a risk that you are willing to take? The issue with heart disease, I think, is more one of inflammation and damage to the artery vessel walls and clotting. And so when you're removing a lot of different things and you're going like a carnivore diet, say, you're going to be massively reducing the amount of inflammation and problems that you'll have as a result of that. And you'll get a lot healthier in general. So also, there was a study that I saw recently discussed at a conference where some of these statins cross the blood-brain barrier and stop your brain from making cholesterol. About 20% of your brain is cholesterol. So it's important. And a lot of your axons are myelinated with cholesterol. So this is a very important molecule. These are very important things to have in your body. You need them. You require them. And they are essential. And so now you're disrupting that. You're not allowing your body to make these things properly and use them properly, right? So, what are the knock-on effects of that? So you have someone who has a statin that crosses their blood-brain barrier, gets into their brain, and they found that a number of people with Alzheimer's, quote unquote Alzheimer's, seem to be on these statins that would cross the blood-brain barrier, like Lipitor, I believe, crosses the blood-brain barrier. And this is one of the most commonly prescribed statins, is Lipitor. And they found that if you removed the statin from these people's regimen, that in 6 weeks, they all of a sudden didn't have Alzheimer's anymore. And then you put them back on the statin, and in 6 weeks they had Alzheimer's again. Okay, so that's reversibility. That's suggesting causation. And so, that's something that you need to think about as well. I personally don't think that, for me, a statin is something that's worth it. I don't think that's something that I need in my body. But there are going to be some people that it benefits. But it does appear that it's unlikely to be due to the cholesterol lowering effects, probably more to do with an anti-inflammatory effect. So you watch that video, The Truth About Cholesterol and Heart Disease. I've also interviewed Dr. Malhotra, who wrote the book A Statin-Free Life, and that's on my channel as well. And you can see his thoughts on that. And he is a cardiologist. I'm just learning this from cardiologists, but he is a cardiologist, and he literally wrote the book on it. So you can check that out. Also check out Dr. Paul Mason, who has done a lot of works and talks on cholesterol and statins. He's published. He's published in the literature. There's a study that he came out with Dr. David Diamond and Professor Ben Bickman. The three of them published a study last year, year before, I think it was last year, about how if you're on a ketogenic diet, which carnivore diet is, you're not eating carbohydrates, you shouldn't be, and that you don't need to worry about your LDL or be on a statin if you are on a ketogenic carnivore diet. So that's a study that's out there as well that you can take a look at, and you can look at their work and then make a more informed decision on whether or not that's something that's good for you. Okay, so here's Rachel. Popped up a question from earlier. Question: my friend's son has autism. Last 7 months developed what seems to be anxiety with screaming, meltdown 1 to 8 times a day. Seen the talk with Allie. That was her son had autism and did very well on a carnivore diet. Would you overview how carnivore can affect autism? Thank you. Yeah. So look, there's a lot of different causes of all autism. We don't know them all, and we don't know how they all are affected. However, it is in the literature that ketogenic diets, removing all carbohydrates and sugars, can actually help quite a lot. And we do know that when you change your biochemistry, you change your brain chemistry, you change how your brain develops. Professor Chris Palmer from Harvard, he's a professor of psychiatry at Harvard, and he's done a lot of work in this field in mental health disorders, and he's reversing schizophrenia and OCD and bipolar and major depression with metabolic therapies, metabolic interventions like a ketogenic or carnivore diet. If a carnivore diet is ketogenic, obviously, if you're eating fruit and honey and things like that, then you're eating a lot of meat, which is great, but you're not actually getting the keto part of it, which you want. You don't necessarily need to be in ketosis all the time, but you probably won't be on a carnivore diet. I've never checked my ketones because I don't care to, because it's not going to add anything to my life. I'm eating what my body's designed to eat, and my body's doing what it's designed to do. Pretty simple. You will likely come in and out of ketosis as you go. If you eat a big steak, enough protein is going to sort of pop you out of ketosis. You're going to come back in a while later. And either way, eating that way, avoiding carbohydrates and having massively elevated insulin all the time, on the aggregate, that seems to do a lot of work, a lot of positive work. So that can be for many reasons. You're reducing inflammation. It's neuroprotective. Having more keto bodies is neuroprotectives. It's likely helping, stave off Alzheimer's or treating Alzheimer's. And the ketones cross the blood-brain barrier. They're not only used as energy, but they also cross the blood-brain barrier, reconstitute into fatty acids, and can actually be used as the building blocks and the matrix of your brain. Also, your brain preferentially runs on ketones. This is likely why a lot of people go on this sort of stuff or their brain fog just goes away, because their brain's running on rocket fuel now. It's not just, old leaded diesel, and the evidence for that, and because other people will say otherwise, they'll say, oh, no, glucose is your primary, but that's because you're saying your primary metabolic state is a so-called fed metabolism when your brain is running on ketones, and you go on a fasting metabolism. Well, that's just a backup, but actually your brain is running on ketones in your fed metabolism as well, which is wrong anyway, right? I eat 5,000 calories in ribeye, I'm not fasting, right? So whatever metabolism I'm in, it's not a fasting metabolism, right? It's just a non, carbohydrate, insulin, driven, metabolism. So that's wrong. That needs to be renamed. But when you are, when you are on a carnivore diet, eating ketogenic diet, your brain switches over to ketones, but it's not because you've run out of glucose. You can actually still have relatively high glucose or normal glucose, but your brain will be running on more ketones or maybe even all ketones. Why is that? Because whatever amount of ketones you have, your brain is running on those. You just don't have enough in normal circumstances to run your brain properly, right? So as you get more and more and more ketones, you run on less and less and less glucose in your brain. There's parts of your brain that still run on glucose, but the big thinky parts, the cortex of your brain predominantly runs on ketones when there's enough ketones available. And so when you reach that threshold where you have enough ketones, your brain just doesn't run on any glucose, even if you have an abundance of glucose. So that means it prefers ketones. It's not a safety measure. It's not just a backup plan. It prefers ketones, right? It's similar with our cardiac tissue as well, cardiac myocytes. So your brain's going to be running on better fuel. You're going to be reducing inflammation. You're going to be giving more substrate for the brain to develop. So this is going to help short-term and long-term in brain development. And you're just eliminating out things that are harmful to brain development. You're also adding in meat, which is vital for brain development as well. You need a lot of these nutrients that you can only get from meat, B12, but also carnitine. Not everyone knows this, but not everyone makes carnitine to the amount that we need. It was shown at University, Texas A&M. They show there's a kind of autism that pops up a lot in vegans and vegetarians, and they find that it's in kids that can't make carnitine sufficiently, and because they're not getting any carnitine from their food, because carnitine only exists in meat and animal products, that they are developing this form of autism, because carnitine is very important for mitochondrial function, which is very important in autism as well, and for neuronal development. So if you don't have enough carnitine, your brain cells won't develop properly. They won't run properly. And so you can develop autism. And so you're eating a lot of meat, especially red meat has a lot of carnitine in it. The other meat and dairy have some, but there's a ton in red meat. So, that's what you need to do. Also, as far as the mitochondria are concerned, it has been shown in studies that after, sort of 3 months or so on a ketogenic diet, that you end up recycling and getting better, newer mitochondria and more of them. So you end up having 4 times the number of mitochondria, and they are 4 times as effective. So this is a massive, massive boost to the energy and function of your cells, including your brain cells. And so that has a massive impact as well. And the reference to Ali, people haven't seen that and have someone in their life with autism, or know someone who has a child or loved one with autism, or a friend, check that out, because that was pretty dramatic. Her, she told me at a conference when I met her, we had spoken online, but we met in person at KetoCon a couple of years ago. And she said that that her son was a non-verbal autistic, but only when eating carbohydrates, which is pretty dramatic. And so she got him on a carnivore diet, and he just started improving. Then he goes over to, maybe, the grandparents' house, and they want to, give them cookies and nice treats and make it a nice experience, which is sort of what you do at when you go to grandma's. You get grandma's cookies, which I remember very fondly, and he would come back and he wouldn't speak for a few days, and you wouldn't be able to speak. And now apparently he's doing so well on a carnivore diet that he's actually tested into a gifted program at school, which is amazing, right? So he goes from nonverbal autistic to gifted going at a gifted rate. So that's fantastic. And this is not a one-off. This is in the published literature. There's a paper that discusses this and argued the evidence and argued for using a ketogenic diet as a mainline therapy for autism. And I've seen it work again and again and again. Professor Palmer from Harvard says the same thing. It's important to get as early as possible, right? Because the brain is still developing. It still has time to undo some of that damage or misdevelopment or whatever has happened beforehand. When we're an adult, it can absolutely improve function, but it's not going to really change the overall structure of your neurons and brain. There's a lot of plasticity, but there's a lot more plasticity when you are young. And so when you're very young, that's when you're going to get the best results from ketogenic carnivore diet. Thank you for a super chat, Carnivore Scott. Have you seen the recent studies where stearic acid C18 signals via a dedicated pathway to regulate mitofusin activity and morphology? I haven't actually. That's interesting. If you could send that to me, maybe put it up in the chats or tag me in like the main comments for this, because the live chat can go away, and I'll try and find that. Stearic acid, exists in multiple sources, so in like, like cacao fat or whatever oil, the chocolate oil fat, but it's also going to be in beef and other things as well in different amounts. And so, but the thing is too, is there's a lot of other fats that go along with all these different fats. And so if stearic acid is, sort of good or bad, what else is it coming with that may also be good or bad as well? And that's something to consider. There's a question here from Linda. Do you have a video about converting from keto to carnivore? I don't have one specifically, but it's something I talk about. Really, you're very close. You've gotten rid of a lot of this other stuff. You're already understanding that fat's not bad, meat's really good. It's really just taking that last step, getting rid of all seed oils, especially only eating animal fats, and then just dropping the vegetables. And that's it. And you'll find that you do a lot better, a lot quicker. Almost everyone does. There've been a couple people that have said that they've had sort of better weight loss or something like that on keto. That may as well be, but I think you're going to be healthier on a carnivore diet, and the weight that you lose is going to be healthier. You're also going to put on muscle, and you're going to be better off for it. So maybe it sort of changes some dynamics, but a lot of people find that when they go on a carnivore diet from a keto diet, they actually they may have sort of stalled in their weight loss, and then they go that last step and just do a carnivore diet, and they're off to the races again. So that's really it. It's just cutting out the last bits of plants and vegetables, and especially the plant-based oils. You want to do animal fats only, really. Oh, there's just another super chat from Rachel. Sorry, I did find your question in there, but you popped another one up as well. But thank you for that. Question from War Mom. Thank you very much for the super chat. What about carnivore for 56-year-old healthy Hashimoto's hypothyroid, full hysterectomy female? Need to lose about 15 pounds. Love weightlifting. Thanks. Well, look, it's going to be the same for you as it is with every other human being on earth. The best diet for you to follow, or the best way of eating for you to follow, is going to be a biologically appropriate, species specific diet. So as Dr. Berry calls it, a human proper human diet, and that's a good way of doing it. So it's more pithy. So regardless of your issues, you're human. And as a human, you're going to have the same diet as other humans. Doesn't matter what the peculiarities are to a lion or to a zebra or to a dolphin. Those animals eat the same thing. And they thrive and benefit the most from the same things. And so that's what I would do. And especially, with yourself, you mentioned your low thyroid with Hashimoto's. Hysterectomy it's not really going to play a role there, but with the Hashimoto's, I have a number of patients with Hashimoto's, and I've seen 10 times, that amount in people online telling me how massively improved their Hashimoto's is. They're coming down off their medications. Their thyroid function is improving. Their thyroid antibodies are going down and down and down. And many people, when they are strict, when they just go red meat and water only, that's when you're going to get the best results. They can actually fully put their Hashimoto's into remission. It takes a while for Hashimoto's, and there's damage being done to your thyroid as well that may not completely be able to resolve and to heal. So you may need to be, but you can't just stop your medications anyway. But you will likely find that you can start coming down them, tapering down with your doctor. And a lot of people come off their medications. So I would definitely recommend that. Are you going to lose weight? Yeah, you almost certainly will. Most people do early on. Everyone does long term. So some people, for other hormonal issues like Hashimoto's, having low thyroid, having high leptin, leptin resistance, and other sort of hormonal disruptions. Obviously, our hormones when we're postmenopausal is not going to be, they're not going to be the same as when we're in our teens and 20s, but they can improve as well. And so when all those hormones and all those biochemical actions in your body start to normalize and improve, then you'll start seeing more and dramatic weight loss as well, and you're lifting weights, which is great, and that's just going to keep driving that. So I would just focus on your health, how you're feeling, be very strict red meat and water only, fatty red meat and water, and try to eat to satiety. Your body knows what it's doing. Your body knows how much it needs, how much it wants. And if you're putting on a little bit of weight, you can also remember that you're going to be putting on muscle as well. So I find it's easier to put on muscle on a carnivore diet than I've ever found in my entire life. And I'm 43. I'm stacking on muscle. I mean, easier than ever. It's just crazy. And and so you're lifting weights. You're gonna put on muscle. As you'll find that you're not losing weight. Why am I not losing weight? Why am I not losing weight? Well, you're putting on muscle and you're losing fat, and that sort of evens out. So just remember that. Focus on your health. Focus on body composition. Distant second. Focus on the scale never. That's not an important metric. You want health and body composition. Are you putting on muscle? Are you losing fat? That's what you want, and that's all you need to worry about. So good luck with that. Thank you for the super chat, Mary Jane. I've been doing carnivore for 2 weeks now. Quit drinking beer at the same time because I was getting pain in my liver and gallbladder. Perfect. That's great. Alcohol is so important to get rid of. Obviously, it's from a plant, so you want to ditch that, but it's just poison. Even if it didn't come from a plant, alcohol is poison. And so, you're just getting into that period now where you're really going to start seeing dramatic differences and benefits. After 2 weeks, you get most of this junk out of your system. Alcohol takes about 3 weeks, and so it's going to be a little more. It's going to take a little more time to really get out, but you'll be feeling amazing right now. And from here on, you're just going to get better and better and better. And so just keep eating meat, keep doing what you're doing, keep eating meat, avoid all the other things. Definitely avoid drinking alcohol and beer, things like that, because they are bad for you. And you will feel so much better when you get rid of those. So really well done. Okay, so super chat from Absolutely Relative. Thank you very much for that. What is your advice to premenopausal women on carnivore diet? 51 years old, just off HRT, hormone replacement therapy. Down 50 pounds in 6 months on Ketovore, which is fantastic, and intermittent fasting, amazing. Almost completely carnivore now. And just quit coffee. Feel great, but want berries sometimes. Yeah, things that we want obviously are not necessarily, it's not necessarily we're wanting them for the right reasons. You want a steak, probably a good idea that you need a steak, but berries and sweets and things like that. These things are addictive, and we remember these things in such a way, and when you're doing, if someone were to do drugs, like sugar is a drug, like cocaine, yeah, you'll feel better. Oh, I have all this energy and all that sort of stuff, and now I really want it, and that must be my body telling me that I need it. Well, no, there's a difference between positive feedback on on a substance where the more you do, the more you want to do. That's a bad sign, because that can't limit itself, right? So you're going to get into trouble. Okay. But things that have negative feedback, where it tastes great, there's a good experience, but the more you have, the less you want it. That is inherently self-limiting. So when you're eating fatty meat and you're hungry, it tastes amazing. But every bite that you have, you get slightly less enjoyment out of it until finally it doesn't taste good at all. And if you keep eating it, it starts to taste bad. And so that's that negative feedback. And so that's something your body's in control of. Something that gives positive feedback in a substance that we eat, that's trouble. You can get positive feedback in exercise when you're on a carnivore diet because you're producing more energy. If you're working out harder, you produce more energy, which makes us feel good, which makes us want to work harder, which makes us feel better, which makes us want to work harder. So that's a good positive feedback. But I'm specifically talking about from positive feedback or negative feedback on things that we are eating and consuming. And so I would just be mindful of that. The berries and things like that. You can also think of it as a hunger signal. Are you hungry? It's very easy to undereat on a carnivore diet. Our hunger signals are much more subtle. And so it could be that I want some berries, I want some carbs, I want some something. Is that your brain telling you that it wants more energy? Try eating meat. If it tastes good, if fatty meat tastes good, then yes, you are hungry and you should keep eating. You should start eating something. And you'll find that usually clears up the cravings. Also, premenopausal women, your hormones are going to improve. Your estrogen is going to go up. Your progesterone is going to go up. Growth hormone is going to go up. Your testosterone is going to be in better equilibrium with your estrogen as well. And you'll find that you may not be so premenopausal anymore. In fact, going back to the last lady, who we answered her question, possible that she's in menopause now. I have seen people come back out of that. Now she had a hysterectomy, so it's not really going to show, with menses or anything like that. But hormonally, she could come back to a much more earlier state. And I see this all the time. I had patients that all of a sudden they were saying that, they're in their 50s, they haven't had their cycle in 5 years. All of a sudden they're like, well, I'm having some bleeding again. I was like, okay, well, when is this happening? So it's sort of happening, every 28 days, like once a month. And is it happening all the time? No, it's really just every few weeks. And then you look at their hormones and everything like that, and they're coming out of menopause. Right. So this is something that Dr. Barry has found. He had a few patients that he put on a ketogenic diet and they came back pregnant. I'm like, what the hell did you do to me? Because they hadn't had their cycle in 5 years, they thought there was no chance of this, so they weren't taking precautions. And then they were very shocked by that, but eventually they saw it as a blessing, which is of course what you'd want. You don't want to be upset about bringing a child into the world, but that's something that's how much of a difference this stuff makes. And the number one cause of female-driven infertility is PCOS, which is largely caused by insulin resistance. We treat PCOS clinically by putting people on metformin, and all of a sudden, bam, they're having kids. Okay, just don't eat carbs. You'll get the same result. In fact, you'll get better results. Because you're doing something that's more healthy for your overall situation as well. So that's what I would do. I just keep doing what you're doing. Just eat meat. Just drink water. Fatty meat. That's where your hormones are made out of. Cholesterol. All of them are made out of cholesterol. Your hormones will improve. And I see people coming off of HRT when they go on a carnivore diet. It improves their hormones that much, and they just feel really good. And even if they don't have this dramatic spike in their hormones, they just feel amazing, and they don't feel that they need the HRT. And so, yeah, I just keep doing what you're doing. You're doing great. And so I wouldn't change anything. There's nothing to fix there. Okay. Super chat from Swine Dog. Thank you very much for that. Hey, Doc, what are your thoughts on high quality olive oil and coconut oil? I've heard they are healthy fats, even though they come from plants. Well, they have some healthy fats in there. They don't have all the healthy fats that you need. There are essential fatty acids that only come from animal fats, right? The omega-3s that you need for your brain DHA, EPA. They only come from meat. There are omega-3s in plant oils. That's ALA. Okay. That is not the stuff that we use in our brain. It's good for your heart, but it's not going to do anything for your brain. You need the other kind, and you don't convert ALA into DHA and EPA. And if you do, it's fractional, very small fractional amounts. So there are also plant sterols. There's a lot of polyunsaturated fats, especially in the olive oils. Better than the seed oil. It's not going through this whole horrible industrial process to make, but you can't cook with them. You can't cook with olive oil anyway, because that will actually break down into very pro-inflammatory factors. And there's more omega-6s in there as well, which are also pro-inflammatory. You need omega-6s, but you don't need all that much. And you don't want as much as comes in most of these plant oils, but you also don't want to cook with them because they turn rancid. They start causing a very high oxidative burden when you cook with them. The olive oil and the liquid fat oils in general. Coconut oil has a lot more saturated fat, so it's less of an issue. Olive oil, I would never cook with olive oil, and and they also have plant sterols, which sort of interrupt our body's normal cholesterol metabolism as well, and that can be a problem also. So I would, if you were going to use olive oil, I would just use it cold. I'd make sure it's actually extra virgin olive, 60% or something like that. I heard some weird statistic that like 60% of olive oil, especially when they export it out of Italy, is not olive oil, and it's certainly not extra virgin olive oil, or it's mixed with like canola oil or sunflower oil or something like that, and low oil. And so that's really not what you want either. And God knows how long it's been sitting on a shelf. And the longer it's sitting there, the longer it has to sort of degrade into these pro-oxidative, pro-inflammatory states. Coconut oil is better because it's solid at room temperature. But in any case, animal fats are much better. You're going to get a better complement of fats. You're going to get more saturated fats as opposed to polyunsaturated fats. And they're just going to be healthier in general. And you're going to get more and better fats that you need. But, of the plant oils, yes, I would agree that actual extra virgin olive oil that's fresh, not cooked with, is better than the other ones. And same with coconut oil. You can probably cook with coconut oil, but tallow is easy. Tallow is cheap, and so that's what I would suggest. And a question from Johnny Ho. Thank you very much for the super chat. 3 weeks carnivore, 1 meal a day. Should I listen to hunger cues when I'm not hungry at mealtime? Feel a bit sick eating that ribeye due to fat. GP wife disapproves. I bet she does. Well, hopefully she comes around and looks at a lot of the different sort of literature and evidence to do with saturated fat and cholesterol. One good resource to show her is the study from the Journal of the the Journal of the American College of Cardiology in 2020, with massive literature. If you look at all the meta-analyses, randomized controlled trials, things like that, to do with saturated fat and heart disease. And they found that there was no correlation, not even a correlation, no association between increased saturated fat intake and heart disease. And in fact, they found an inverse relationship between saturated fat intake and stroke. So more saturated fat intake, less stroke risk. Less saturated fat intake, higher the stroke risk. Okay, so that's something that she might be well interested in, because that's a major study published in a major journal, and by a lot of authors who actually previously published things, excoriating saturated fat, saying that, oh, this is so horrible, this is so bad, and now they're saying like, okay, we got it wrong. So they are saying, they're the ones who were pushing saturated fat is bad. They are the ones saying, no, it's actually not. It's not an issue. There is no upper limit on the amount of saturated fat you can eat. That's their words. So no, you don't need to force yourself to eat. Your hunger signals will be different. So you may not feel hungry in the traditional sense, but if meat doesn't taste good and you're sort of eating that going, ugh, I don't really want to eat this, don't eat it. If a steak doesn't taste good, you are not hungry. But if it does taste good, you are. So listen to that. Think about if you're feeling a bit off or feel tired or this, that, and the other. having cravings for some sugar or carbs or something like that, think to yourself, okay, is this my body telling me I'm hungry? Try eating some meat. If it tastes good, then yes, you are. Keep eating until it stops tasting good. But if you're doing one a day, usually you should be hungry by that if you're waiting 24 hours to go. But if you're not, you're not. I would try eating some meat. If you start eating it, tastes great, great. You don't have to finish your plate. It's okay to have leftovers. I actually endeavor to have leftovers because I want to satisfy my body's desire for meat. And so I want to make sure my body's getting as much as it needs and much as it wants. And so I try to cook more than I think I'm going to want. And I just eat until I don't want to anymore. And then I stop. I put it in the fridge. It's not a big deal. But yeah, if ribeye doesn't taste good, something's wrong, right? And it's really because you're not hungry. So I just wouldn't eat it. You don't have to. You don't have to, especially when we're losing body fat and we have excess body fat. Our body is more than happy and capable of using our stored body fat. And it may be that just we don't need it today. Come back to us tomorrow. So if meat doesn't taste good, just stop. That's when you stop eating. It's when meat stops tasting good. Okay, so thank you very much, Fireside Short Stories, for the super chat. Question: I have 9 inches of small intestine removed due to Meckel's diverticulum. Would too much red meat cause discomfort when passing through the area? Also, I was only born with 1 kidney. Is carnivore bad for me? Well, answer the second question first. No, carnivore is not bad for you. It's still your biologically appropriate diet. Just get enough fat. Just make sure you're getting about 1 gram of fat per 1 gram of protein. Then you won't have any sort of concerns or issues. It's generally only when you start getting about, the figure I heard was 4.5 grams per kilogram of body weight is when you start putting undue pressure on your body from protein metabolism. But there are a lot of studies that actually show that more protein equals better kidney function, not the opposite. And so, up to a threshold. Okay. But it's very difficult to eat too much fat and protein because first of all, it stops tasting good. Your body doesn't want it. And you're very satiated by it. And your body just shuts down. Shuts down your desire to eat it. You can force yourself to do it, but mostly that's from just powering down a bunch of protein drinks and things like that aren't under that same control as when you're just eating real food. As far as having that bit of intestine removed, no, that shouldn't cause any problems from eating meat because especially eating meat because you're going to liquefy and absorb it before you get to that point. The vast majority of it. Your body will absorb 98, 99% of the meat you're eating. Certain parts of your intestine, if you cut that out, that's less area for your body to absorb, nutrients. So maybe you're going to get a bit less of an absorption, but hey, it's going to be liquid at that point anyway. It's not until it goes into the colon that's going to solidify. If you're eating fiber, however, that stays solid. You can't break it down. You can't turn it, there's insoluble fiber and soluble fiber. So the insoluble fiber is not going to be soluble. It's not going to go into a solution. And so it's going to stay that solid form. That's going to cause problems, especially if, when you have this anastomosis, the reconnection of those parts of the intestine, if it forms like a bit of a narrowing or a stricture, that can cause a lot of problems if you're eating fiber. So no, I think you'll be better off just eating meat and fatty meat. Make sure you're getting enough fat that keeps everything, well lubricated and moving. So yeah. That's totally fine for that. And I think probably beneficial for that and many, many other reasons, all the normal reasons as well. Super chat from Andridi. Thank you very much for that. There's no question attached, but I'll keep an eye out in the chats to see if you popped one up after that. But and if not, then just thank you for the super chat. Question from Hoisian. I'm sure I mispronounced your name. I apologize. Are there any carcinogens in meat? Not that I know of. There's a potential for the byproducts of cooking meat that have been suggested could be carcinogenic, but these are in animal models, so we don't know how that translates to humans, and they are at levels thousands of times higher than what we would eat. So is that really something that that we need to worry about with us? I don't get too worried about it. We've been cooking meat as humans and pre-Homo sapiens for at least 800,000 years. From 800,000 years to 1.5 million years, we have been cooking meat. And Homo sapiens have only been around for at most 300,000 years. So we're well used to it. Whatever's coming in down the pipe with cooked meat, we've dealt with it. Now, does that mean smoking brisket every single day and that's all you eat? Is that going to be good? Well, you maybe you're going to start increasing more and more and more of those chemicals. But the fact of the matter is that those studies that suggested that in animal models, so it's preclinical data, and it's thousands of times the amount that you'd see in in just burnt food. So, but in meat itself, no, I don't know of any of those. And when I talk to people about this, they say, no, you can't do that as a carcinogen and all that sort of stuff. It's like, okay, what are the carcinogens? No one can tell me what the carcinogens are. Now, there's suggestions that it may influence mTOR or have these, cooking products and all these sorts of things, or that certain things, if you have certain gut microbiome can do. These are all maybes and kind ofs and could be's. That's it. So there's nothing like this is a carcinogen. This is benzene. This causes cancer. Like in sunblock, there's actual carcinogens in sunblock, which is wild. But no, I don't know of any in meat. And the WHO has a website that's dedicated towards natural toxins found in food, and some of which they say are carcinogenic or mutagenic or directly toxic. There isn't a single one that's in meat, not a single one. The entire page is all about things that come from plant and algae. And sometimes the animals can eat that algae and you can get that, and that can be harmful, but none of it exists in meat. And there was a study from the University of Washington in Seattle where they looked at hundreds of studies looking, suggesting that meat caused heart cancer or colon cancer, and they found that they were very weak studies. They were very poorly designed. They were garbage, basically. And so we have this meta-analysis, blah blah blah, junk in, junk out, right? Garbage in, garbage out. You put a bunch of garbage into the meta-analysis, you're going to get a bunch of garbage out. It doesn't clean up bad study designs. If you have a couple bad study designs or something like that, in the aggregate, maybe it can clean it up if the other ones are good. But if they're all crap, then it's just going to come out crap. And so they found that there was no connection at all between meat consumption and cancer, and especially in red meat, unprocessed red meat. Okay, so the WHO says processed meat is a carcinogen. Red meat is probably a carcinogen, but we don't know. We don't know of anything actually specific, right? But the processed meat is. Okay, so there's a difference there. Why is there a difference between meat and processed meat, right? What is it processed with? They add more meat? No, they add plants, spices, sugar, artificial sweeteners, and preservatives and things like that. So if meat is not carcinogenic and processed meat is carcinogenic, which it's probably not anyway, then it's something that you added to the meat. That's the problem. It's not the meat itself. It's not something inherent in the meat, right? It's something that you did to the meat. So it's not the meat. And that's what the University of Washington found as well. And that's what they concluded. So no, I can't think of any of these things that would be a problem. And then super sticker from yourself as well. Thank you very much for that. It was very kind of you. Let's try to see if I can find Andriti's comment here. See if there's anything in here. There we go. Andriti, my mom is 10 days post intracranial bleed for head injury. Hospital diet is awful. Yep, that's very true. Not eating much, probably for the best. Any tips for supporting brain healing? MCT oil? Yeah, sure. MCT oil, but just fats in general, animal fats in particular, omega-3s. This is what your brain needs, and you need ketones. So ketogenic diet, this is in the published literature. This is not supposition, that Ketogenic diets help traumatic brain injuries. Okay. So, we can sort of think about that intracerebral bleed. You've had brain bleed in the parenchyma of the brain, and that's caused brain damage. Okay, well, this is helping damage from traumatic brain injury. Could this help healing of other sorts of causes of brain injury? Absolutely. And you want more ketones. Ketones cross the blood-brain barrier, and they reconstitute and form physical structures in your brain. You need more fat. You need more cholesterol. You need more proteins. You need the things that you are made out of that your body is supposed to have, which is meat. You want to avoid all those things that are going to cause harm, which is carbohydrates, plant toxins, and all the other sorts of issues and other sorts of chemicals that can be an issue. I would say the hell away from any carbohydrate or sugar, especially alcohol. But they're not going to give people alcohol, but they give them sugar, and sugar does very similar things in your body to alcohol. This blows my mind. But there's a lot of influences in the hospital system, and most hospitals have just high octane crap that they give people. It's just sugary carbs. That's it. That's the worst thing you can do for someone who is recovering from a brain malady and abnormality or damage. So I would say the hell away from that. I would bring in food. If I remember correctly, your currency was Aussie dollars. So if you're in Australia, you can still bring in food. It's still a somewhat free country, but so I just bring in food. And if you can get her onto a ketogenic diet, if you can convince her of doing that, sometimes when people are sick and they're hurt and they just need things to be simple. But if you can get her on that, I think that would be very helpful. At least get her more meat, at least get her more animal fats. That's going to be very good for her brain. If you can get her on a ketogenic diet, that has been clinically shown to improve brain healing. And that's what I would do. So yeah, good luck with that. I hope she does well. Okay, so it's a question from Bo. I've been going just 18 days, eating beef, lamb, liver, bacon, eggs, avocado, butter, and cream for 1 to 2 meals a day. And during the past 4 days, I've struggled with the lack of variety. Any tips? Well, you do get used to it. People are accustomed to eating a whole bunch of different things, but that doesn't mean that you need any of those. And sometimes it's more of just a conditioned response as opposed to your body's telling you need to eat something else. So if you're eating a lot of beef, lamb, liver, all that stuff is great. If you're finding that it doesn't taste good anymore, that's your body telling you don't need it anymore. Okay, so just listen to that. Eat fatty meat until it stops tasting good. Okay. And once it stops tasting good, just stop. You don't need to eat. You don't need to eat 3 times a day, 4 times a day, 6 times a day. There are people saying you need 3 meals and 3 snacks. Bullshit. You need to eat whatever your body's telling you to eat. You just need to eat the right thing. And if you do that, your body will tell you. And you can go by taste. So if things taste good, if meat tastes good, then you keep eating it. Lean meat will stop tasting good much quicker. You might feel hungry, but you don't want to eat that. You need the fat. So again, try to shoot for around 1 gram of fat for 1 gram of protein. That's about where you want to be. Then for your individual needs and desires, you might go up and down from there, but shoot for that and then adjust from there. Most people are going to be eating far too little fat. Bacon, great. There's different kinds of bacon. Some are fattier than others. If it were me, I'd get rid of the avocado, and see how you go. But I mean, as far as everything goes, it's probably the lesser of many evils. Avocado ripened on the tree has far less oxalates and other toxins than if you pick it green. And so someone was saying the other day that, everything comes off green off an avocado. They don't ripen on the tree. I had avocado trees as a kid. They can definitely ripen on the tree, and they'll fall off, and they're all just nice and squishy and great as well. So I didn't have that experience anyway. But either way, you want to ripen them as much as they are able to ripen on the tree before they are going to fall off, and that takes out a lot of those toxins. Hard to do. Almost all of them commercially are picked rock hard green, they're going to have like 4 times the oxalates and a bunch of other things in there as well. So just something to think about. But yeah, look, if it's not tasting good, you're not hungry. Don't worry about it. Super chat from LECHF. Thank you very much for that. Switched from vegan to a lion diet. Very well done. That's brave. More neurodermatitis now, less other problems. Can't sleep because of the neurodermatitis. What can I do? Thanks for the help. Well, that's a good question. You can try eating different things. Try having a food diary. You know what you eat, when you eat, how much you eat it, and the benefits or detriments after that. I feel great. I feel this, or you have this problem. When did that come afterwards? Is there something associated with the food that you're eating? A lot of people eat a lot of different kinds of meats. Some people need to be a bit more careful, like the people with autoimmune issues that I was addressing earlier. You just have to be on red meat and water, and some people have to be on grass-fed and finished red meat and water. Less often. Most autoimmune sufferers, even people who are very sensitive, just grass-fed, grain-finished is acceptable, and they do fine with that. Some have to be even more strict than that. So that's what I would do. Any time you're having issues like this, just start paring it down even more and getting it more and more refined down to that, closer and closer to just grass-fed and finished, fatty red meat and water. You need the fat. That's very, very important. Make sure you're getting enough fat. Make sure you're getting enough food in general, and then get rid of everything except red meat, and see how you go. And hopefully that improves. Sometimes we have weird things. We're getting we're losing fat. We have fat soluble toxins and things like that. Things are clearing out of our body, and we're reacting to them. And so sometimes people get rashes. They'll get like a keto rash, or whatever they call it, and it's generally transient. It generally sort of comes and then it goes away again when your body's cleared all this stuff out of there. So that's what I would do. Just get down as strict as possible, as close to red meat and water as possible, and then give your body time, and hopefully it works its way out. And using a food diary is very helpful, and seeing if that aligns with your symptoms, align with different things that you're eating. And then if you can sort of adjust the things that you're eating or when you're eating them, that might help as well. So good luck with that. I hope that helps. Question from Rachel Garth. Thank you very much for that, Rachel. What's the truth about eating meat and eggs from the fridge after having no power for almost 24 hours? Toss it. If I die, if I don't, will I die if I don't? Power just came on fine. 24 hours is not all that much. If you left your fridge open the whole time, then it's going to warm up. But like I keep eggs on the counter all the time. After a while, I mean, they won't last as long as necessarily in the fridge, but eggs are designed to just sit out in nature, right? They're not supposed to be in a refrigerator. So they'll go off eventually, but 24 hours isn't going to be long enough for that, especially when refrigerators are closed. They're actually quite well insulated, and so you generally won't lose all that much of the cold in there. The meat lasts even longer, generally. Depends on the meat. Chicken, fish, pork, they don't last as long as like beef and lamb. But I'll leave steak out on the counter. Come out in the morning and put a steak on the counter, cover it up or whatever. So, you'll get things on it. I'm a cat now. A cat will definitely get on it. And so I have that covered. And, then I go to work and do all my thing, and I let that come up to room temperature, and then I cook that, and it's just, a bit more convenient for cooking. And then sometimes I come back and I'm just like, I don't have time to eat this. I'm stuffed and I'm busy. And, maybe I grab something, on the way home or something. Or maybe I just don't have time to really eat that. I need to make something quicker or just not eat it all today. And I put it back in the fridge. If it's just sat out there all day, it's fine. If it's visibly rotting, if there's visible mold or rot or something on that, then that can be an issue. At least cut that part out. But 24 hours, I would really doubt that something went off in 24 hours. But you also do the smell check. You have some chicken in there, you smell it's like, ugh, it's a little gamey. yeah, maybe throw it away. I don't do the whole high meat thing, the whole let it rot sort of thing. Our ancestors did, because they didn't have refrigerators, and so they had to sort of be eating more gamey meat or carrion meat. And our stomach acid, if you're keeping that nice and low, you're not drinking a bunch of water before you eat, um, you will likely kill off most of those bacteria. But there can be these sort of super toxins that especially like what is it, Staph aureus, they make, Staphylococcus will make like this sort of nasty toxin that doesn't matter if you cook it or your stomach acid or whatever, it's gonna make you sick, and so you can throw up and things like that. But that's fairly rare, but that can happen. 24 hours unlikely, but use your judgment and see, if it sort of smells off, then just avoid it. If you crack an egg and it's sort of cloudy and weird and smells a bit funny, you can avoid it. 24 hours is very, very small amount. I leave meat, I cook a brisket, I leave it on the counter for a week, and I just cut off chunks as I go. Meat lasts a lot longer than they say it does. There's a movement down in Australia now for like processed meats, like deli slices. These things will last, through the next Holocaust, the nuclear Holocaust. They're saying you shouldn't pack lunch meat in your kids' lunches anymore to go to school, because it could be 2-3 hours before they get to lunch, and it can't be refrigerated. So it could just be toxic at that point. That is bullshit. These people not remember when they went to school? Like when did their lunch meat turn rancid? In the time that went from their house to lunch period at school. That's just absolute bullshit. And people they're just really trying hard to malnourish people and just make them just weak and supple and controllable and harmed. This harms people. This harms kids, especially. You're not getting enough meat and protein and animal fats. Your brain doesn't develop properly. Your body doesn't develop properly. Your hormones don't develop properly. This is not okay. And they're pushing this nonsense. So don't believe the hype. Meat doesn't go off that quickly, but just use your judgment on what it's like. Okay, just getting down here. So there's another super chat. Thank you for that. It's not coming with a question again. But I'll keep an eye out for it, see if that question actually came up somewhere down the track. So that's saying question, awesome work, by the way. I don't know if well, thank you for that. I don't know if there's another question with that. I'm not seeing it anyway. Well, I'll keep an eye out for it anyway, and if it comes up, I'll try and answer it. Super chat from Greg Wilkins. Thank you very much for that. I'm going to mess things up, or am I going to mess things up by taking AG1 along with my carnivore journey? AG1. I don't know what you're referring to by that. Let me just look that up. I'm just going to Google that really quick. Is that Athletic Greens, I guess? I wouldn't do I wouldn't do it. 1 scoop of AG1 of Athletic Greens contains nutrients blended over 75 bioavailable ingredients specifically designed to support gut health and all that stuff. So I don't think you need it. Are there going to be good things in it? Oh, absolutely. Are there going to be other things that aren't good in it that come with that? Absolutely. So, or more than likely anyway, unless they've completely isolated out all the different things. And there's complete isolates, like complete protein isolates and vitamin mineral isolates, which it doesn't sound like it is. Then I would avoid it. Personally, you don't need it. If you need anything more than just, steak and ground beef or eggs, it's liver. You just add in a bit of liver. That's going to have everything else you need. And you don't want too much, because it can have too much as well. You can get a buildup of especially the fat soluble vitamins like vitamin A, and that can cause problems. That can cause suppression of your thyroid stimulating hormone. It can depress your thyroid output as well. And so, just eat meat. Meat's going to have be more nutrient dense than the athletic greens, certainly, and it won't come with anything that you don't want or don't need. You'll feel better. You'll feel a lot better with just meat. Then 3 months down the track, get your levels checked. Get your your vitamins and minerals and all these sorts of things checked. And if you're in good ranges and you're improving, you don't need to change anything. If there's maybe a bit low on folate or something like that, just add in some liver. Just like once or twice a week, have a bit of liver, don't overdo it, and you should be fine. So I don't think you need athletic greens anyway. If you wanted to take them, I mean, you're welcome to, but I don't think you need to anyway. I don't think they're going to benefit you more than just eating a proper human diet. There we go. There's a question from Marius. Thank you for that for the super chat question, Dr. Chaffee. Awesome job, by the way. I've been doing carnivore for 2 weeks now. I get pain in my lower back or in the lower back of my head. What could cause it? A lot of things. A lot of things can cause headaches or pains. It's very difficult to say. Headaches are a bit of a pain because a lot of things can cause that. Now, if it's sort of pain in the sort of where the neck meets the head and a sort of muscular sort of thing, that can be strain. It could be how you're sleeping. If you never sleep with a pillow behind your head, that's really bad for your neck, and it can cause a lot of pain and discomfort during the day. Sleep on your side or on your back without a pillow. Put a roll under your neck, and that can help the arch, the normal lordosis that you want in that part of your spine, and that really helps with neck pain as well. If it's a headache, that's sort of in the head, but just sort of in the back of the head, there are a lot of different things that can cause headaches. If this is a new headache or if this is an old headache, it makes a difference. If this is a new headache, try drinking more water, just eat enough meat, enough fat, and that should hopefully be better. If it has other symptoms related to it, maybe something you need to sort of get checked out or get a scan for. A lot of different sort of things, but a lot of people will have these different sorts of weird aches and pains, which will improve. Just keep going, eating just fatty meat, water, a lot of water. You need enough water. Number one cause of headaches is dehydration. It's the first thing we do when people come in to the emergency department with a migraine is you stick them on a bag of fluids, and then you start giving them meds after that. But first and foremost, you get them on fluids. So drink enough water, eat enough meat, and make sure that you're in a neck neutral position throughout the day and at night as well, because you can obviously strain your neck. There are other things outside of diet that we can do to our bodies that are not fun, and so you need to sort of think of those as well. And I would just keep going. It's been 2 weeks. You're just getting into that sweet spot where you're just going to start getting better and better, and all of these the inflammation and things like that are just going to get better and better and better. So I would just keep going as you are, and hopefully this sort of clears up, and you'll just be mindful that there can be other things that are causing a strain as well. And if this persists and just keeps going, you keep having headaches, just go and get a once over by your doctor. Question from Sophie. Thank you very much for the super chat. Reduce saggy skin as I lose? Question marks. Well, will your saggy skin reduce? Keto carnivore, 2 years, lost 65 pounds and 100 more to go. Has binge disorder and prefer 1680 sort of fasting eating window. Qualify for a knee replacement, so can't walk well for long distances. Dumbbells, what will help? Look, anything you can do as far as exercise is concerned, try things like the exercise bike, like a stationary bicycle. That can be very helpful, and it's much less impact. So you're not going to have even the impact of walking can be a bit too much for people. So keto carnivore for 2 years, so that's great. You're going to lose a lot of the inflammation. If your knees are still really bad at that point, then I would just go with the exercise bike. So the stationary bicycle, you can use dumbbells as well, doing resistance training as well. And then when your weight comes down, that could be easier on your knees as well. Taking off 65 pounds is massive. That's going to help your knees out a lot. Getting rid of another 100 pounds is going to be eat it even more. And so hopefully at that point, your knees will be, good enough that you can walk around and be more active. But until then, stationary bike, I think, is your best bet. Um, and your saggy skin, a lot of people do find that their saggy skin reduces if they're eating enough, and they're eating enough fat, eating enough meat, getting enough collagen, which comes with all of that. Skin seems to shrink down with them. Your skin is an organ. It's very sophisticated in a lot of ways, and that's one of them. So if you're losing weight rapidly fast, like with surgery or with a bunch of medications and what is it, like drugs and things like that, like stimulants and things like that. Jesus, why can amphetamines? My goodness, why can I remember that? If you're taking those sorts of things, that that can cause you to lose weight faster than your skin can sort of catch up with it. But if you're doing it just with keto carnivore, most people find that they lose or that they shrink down their skin. Not everyone though. Sometimes you will have excess skin or baggy skin, just because you're it's just that's what your body is like. Now a lot of people find that it does shrink down and they don't have a lot of loose skin. So hopefully you're in that case. And then I would do the exercise bike and weightlifting if you can. That would be great. So question from Hoisian again, is another super chat. Thank you very much for that. I'm in keto, soon to be carnivore. Okay, great. You mentioned there's a lot of different carcinogens in vegetables. Are there any carcinogens in meat? No. So I answered this earlier, and you might be able to go back and take it back when I did. No, there's no carcinogens in meat that I know of. Some people say that if you cook meat, they can have some of the carcinogens from the cooking process. But first of all, those were done in animal studies. They weren't done in humans, and they were done with levels thousands of times higher than you would get in just cooking meat. We've been cooking meat for at least 800,000 years, possibly as much as 1.5 million years or more. And so Homo sapiens have only been around for 300,000 years. So at least a 500,000 years before we existed as a species, humans have been eating cooked meat. So I think whatever happens after you cook meat, you're well and truly adapted to it at this point. Also talked about in the University of Washington showing that the studies suggesting that meat caused cancer were completely bogus. They were just junk science, junk studies, and can be ignored. And that the better studies show no, there's no association between meat and cancer. So for the full version of that answer, go back and rewind it back to where I addressed that. And hope that answers your question. So a question from Carmen. Thank you very much for the super chat. 60-year-old carnivore for 6 weeks now with 5 days urinary incontinence gone. Great. Lost 6 kilograms. I feel rested when I wake up. Joints feel freer and regained balance. People ask me about parasites. Are you eating raw fish? Then probably you'll be fine. There are no parasites to speak of in farm raised animals, livestock in Western countries. Just not. And even where you have an immune system that is specifically designed to contend with parasites as well. Obviously, you can have big problems with parasitic infections, but we do have defenses against these sorts of things. And in fact, a lot of people find that or are suggesting now that these allergies that we're having to things that we shouldn't be allergic to, that comes from our immune system that normally fights parasites. And that they're just going crazy because we're living too sterile of a life. We're not, playing around in the dirt like we used to, and just soap everywhere, disinfectants everywhere, and it's just not how we're designed. So people are getting, freak out, emergency sort of allergies to things, and then they go and expose themselves. There have been people that have gone and exposed themselves to parasites, completely resolved their allergy issues. So there's that, but no, you're not gonna run into parasite issues from store bought meat. Now, wild game, sure, yeah, that'll have parasites in it. So you really don't want to eat that stuff raw necessarily. That's why a lot of people will cook game meat more well done. So that's a thing to think about as well. And I think that's probably a benefit of cooking that we found. Oh, it harms it, denatures certain amino acids, and maybe these carcinogenic sort of factors or whatever. But what it does is it kills all the parasites. And so I think that probably gave people who were cooking a survival advantage because they were benefited from getting rid of those parasites. I would bet that played a role. And but no, I wouldn't worry about that. I eat raw beef and things like that often, or very slightly cooked, just sort of sear the outside and raw on the inside. You're not going to get parasites in farm meat. Even in pigs, like in America, it's been like something like 25 years since the last episode of trichinosis was found in pigs in America, unless something came out more recently. But last I heard, it was like 25 years. So, no, unless you're doing wild game or wild fish that's not sashimi, because they treat sashimi and the sushi fish in a special way to sort of get rid of any parasites and things like that. But that's a bit more of a risk. But with normal like meat, like beef, lamb, chicken, pork, even, no, you're not. That's not really a concern. Thank you for the super chat. Anyway, Enemas. Okay. 60 days in, 34-year-old female, new occurrence of hyperglycemia symptoms 15 to 30 minutes after I eat. Blood sugar reads approximately 245. My goodness. Occurs if eating small amounts of carbs or OMAD advice. Okay, so I just want to make sure that I understand that completely. So 60 days into a carnivore diet, but you're mentioning that it happens if you eat a small amount of carbs. So, generally you won't be having any carbs unless you're like drinking milk or something like that. So I would not do that. If you're getting like a big spike like that, look, you're obviously insulin resistant and having issues with your blood sugar, or you would not have that reading 34. That's pretty impressive for someone who's 34. But if you're getting that with one meal a day, split them up. You're having some weird reaction and you're getting hyperglycemic to that extent, split it up, and eventually your body will heal. Your insulin will become more sensitive and reactive in your body. You won't need as much of it, and I wouldn't worry about that. I would get rid of any and all carbohydrates, including from dairy. Just get those things just out of your entire life. Just flush them out of your house. So that's what I would do. I would only eat meat, only drink water. Fatty meat, very fatty meat. If you're doing a lot of protein, especially in the combination of carbohydrates, that will spike your blood sugar more than it will otherwise. So just fatty meat, very fatty meat, 1 gram of fat per 1 gram of protein. Aim for that and then adjust as needed. But most people don't realize how much fat that is. They generally eat way too little fat. Get rid of all carbohydrates, absolutely all carbohydrates. You can't have them basically with those readings. You just need to stay very far away. Question from Robin: will higher fat help with TIA as well as stroke? So it will help your brain recover. It will help your brain in general. Ketones in particular are neuroprotective and they're beneficial to your brain. I spoke earlier about ketogenic diets helping with like TBI, so traumatic brain injuries. Is that going to help with TIA? Is a transient ischemic attack, right? So that by its nature isn't causing permanent damage. You sort of have this little issue. Ooh, what the hell was that? And then it gets better and goes away. So there's no permanent damage done. A stroke is permanent damage, or potential for permanent damage unless it's intervened upon. So will that stop further future strokes? Well, it depends on what's causing the strokes. First of all, you could have atrial fibrillation and having this wonky heartbeat and then flicking off clots from the heart. That's very common. So is it going to help with that? No, probably not. You'll need to get on some blood thinners for that, and possibly get like an ablation or get that atrial appendage, gotten rid of. And that is, that's something that you may still have to do. Could it possibly help? Possibly, but I wouldn't bank on it. There are other things that can trigger these things off that have nothing to do with food, or it's damage done after a lifetime of doing these things, and then you can't really recover all the way from that. So just remember that. But in general, carnivore diets help your brain function, recover, heal, all these sorts of things. And again, going back to the Journal of American College of Cardiology study in 2020, large study, looked at all the best literature. So it was like a literature review sort of paper that they published. They found an inverse relationship with saturated fat and stroke, right? So more saturated fat people were eating, the lower their risk of stroke. The less saturated fat they're eating, the higher the risk of stroke. So in that context, speaking generally, yes, it can help with that. Yeah, absolutely. So, but just eating what you're supposed to eat is going to help your body in a lot of ways. Is that going to stop you from having anything happen? No. You've had a lot of damage to your body, and that damage is still there, and you could still have something that flares up and pops up. And even on a carnivore diet for 2 months doesn't protect you from 60 years of improper lifestyle and eating choices. It just is. So you can have these things coming up, and there's just sort of this looming sort of monolith that you're coming up to. But it's doing the same thing that you did before is only going to move you there faster. And so going on eating what you're supposed to eat, what you're biologically designed to eat, is at least going to reverse what it can and help you out in the future. Is it going to stop everything? No. But is it going to heal everything? No. But it can help you significantly, and it can reduce your risk for certain things significantly and improve your overall health significantly. And so I still think that it's very much worthwhile doing that in any circumstance. Or any circumstance. I haven't come across a circumstance where I would say no. Anyway, that's I can't think of any anyway, and I haven't seen any. Super chat from Derek Brewer. Thank you very much for that. Retired military, 44 years old. BMI, blood pressure, and blood sugar are normal. Great. At 42, cardiac arrest, VFib, CPR, left hospital with indwelling cardiac defibrillator. Possible genetic long QT syndrome, which was ruled out. No definitive answer on why. Any concerns on carnivore? Well, first of all, I'm very sorry that happened. I'm very glad that you made it and they were able to save your life. And that's one of the best things about modern medicine is we can do that sort of thing where people are sick, going towards dying. We can stop that really well. And I think that's a miracle of modern medicine. And that's some wonderful sort of things. The problem is getting you from sort of sick and recovering to optimal and thriving. That modern medicine isn't very good at. It's good at staving off acute causes of death, but not getting you thriving. And that's where nutrition comes into. Concerns on carnivore? No, my concern is if you didn't go carnivore. My concern is that this would get worse, and those problems that you were having that are likely going to be, if not precipitated, at least worsened by inappropriate diet. Going onto a carnivore diet, you're going to improve your body and your health, your life, and your brain and your cardiac health as well. And that's, I think that the evidence for that is very, very strong. And so, no, I have no concerns there. I think that you will absolutely benefit from that. And if I was in your circumstance, I would do exactly that. I think that would be, I am doing exactly that, and if I thought it was going to cause heart disease in myself or others, I would A, not be doing it myself, and B, I certainly would not be recommending this in other people too. And I certainly as hell wouldn't allow my parents to do it, who are doing it. And my dad's parents have had died of heart attacks and strokes, and so he was doing Pritikin diet since I was a kid, Pritikin being a Seventh-day Adventist who pushed a vegan diet, unbeknownst to the world, because it was really more just very lean, boiled meat and all that garbage, very low fat, but also low sugar. And so you get rid of seed oils, you get rid of sugar, actually probably okay, but you also got rid of fat, animal fats and meats, which are actually really healthy and beneficial. So we were doing that forever. My dad was always very worried about getting heart disease and having a heart attack and not being there for us, not being there for my mom. And that consumed him. And I would absolutely not be able to get my dad on this unless I was very, very convinced of this, that this is the beneficial thing to do for specifically heart disease as well as all these other things. And my parents have improved massively on a carnivore diet. And that's just, and they're just getting better and better and better. They're aging backwards. They look, 10, 20 years younger than they did before. And they always looked 20 years younger than they were. And so, they're still older. My parents are just turned 80. My dad's turning 83 in September. My mom is turning 81 this November. So, it's, and they're doing great. They're completely independent. They have no real issues. They've come off massive amounts of medications. They're still on a couple, but my mom's off all of her diabetes medications and insulin and things like that. She still takes a bit of metformin, but metformin is good for other reasons as well. So her doctor wanted her to stay on that. And, it's their lives are massively improved and no issues with their heart or anything like that. So no, I don't think there's any sort of concerns there. Arena New, thank you very much for the super sticker. That's very kind of you. I really appreciate that. And get down here to Stefano. Thank you very much for the super chat. It's very kind of you, very, very generous of you. So I have a friend, his son is 4 years old and picked up foot and mouth infection. Would a carnivore diet help? Thank you. So I'm not a pediatrician. I'm not too well versed in pediatric conditions like foot and mouth, but in general, a carnivore diet is going to help. In general, it's going to help with immune function, with body function, and developments in kids. And I think it's really important for kids to eat properly and to eat high-fat, meat-based diet and get the hell away from carbohydrates and sugars. I think that is vital for them and vital for their brain development in particular. You need those ketones. Your brain needs those ketones, especially in development, and all the other fatty acids and fat-soluble vitamins and things like that. You need those things, and you really want to avoid things that are going to curtail the development of your brain. It's very important. And so I think that I don't know if it's going to help with foot and mouth. It will help with immune function in general, but it will most importantly help with his development. And he'll just be a healthier, happier kid, and healthier, happier, more stable functioning, less erratic and volatile teenager, and a taller, smarter, stronger adult. So that I think that would be a very good idea for him to do that as a short-term and long-term measure. This question from Briar Rose. Nice to see you, Briar. Briar is one of my early followers, all the way back at sort of the beginning of my YouTube channel. So it's good to see you still around. Is there any legit reason why I would feel like eating a little dairy around that time of the month? Maybe to be sure I am making progesterone leading up to it. Yeah, there are arguments for that. There are people, I haven't sort of delved in too deeply into their arguments as to why they think that's important, because I don't think it sort of makes a lot of physiological evolutionary sense in general. Lions don't go around looking for tubers, before they go into estrus. Why would we? And the Inuit, they never do that. I don't think they're milking seals or anything like that. So they're just eating meat, and they still have babies, funny enough. So and during all the ice ages and all these sorts of things, you don't see any animal in the wild fundamentally change their diet to that degree where you're eating just really outside of your species, when you're going into estrus or becoming fertile. So I don't think so. I personally don't think so. If you're sort of getting those cravings or something like that, Um, is it the dairy you're craving, or is it the carbs from milk or something like that? I don't know. Some people argue that you want a bit of carbs for the progesterone. I think that we've been doing just fine without. Maybe some people can benefit by that. Um, and that's something that people can decide on an individual basis. But I think from a population basis, and almost certainly from an individual basis, that no, you wouldn't need to eat any differently just around your time of the month, because you just don't see that anywhere else in the wild. And the Inuits aren't doing it. The Nanette aren't doing it that I know of, and the Inuit aren't doing it because they can't do it. It's just nothing they can eat anyway up in the Arctic Circle. And then our ancestors during the ice ages, they weren't doing it. So if this was vital, if this was necessary, we wouldn't have made it. We wouldn't have made it through those conditions. So I don't think you have to do it anyway. And I don't know why you would need to, or why it would benefit you um, any more than just eating a proper diet, because you just don't see that anywhere else in the animal kingdom. So I would hazard no on that one. Anki Ruda, thank you very much for the super chat. Greetings from Cape Town. Awesome. That was a terrible accent, but Cape Town anyway. I have sarcoidosis of the skin on eyelids, upper lip, and nose on day 3 of just meat, eggs, and sparkling water. I'll give it 3 months before seeing any change. Yeah, look, these sorts of things can take a long time. I don't know of any studies on like keto and sarcoid and things like that. Probably are. I don't know of them. But I've come across a few people who actually improve their sarcoidosis. Brilliant. That's the sarcoidosis is it's a really nasty disorder, and obviously that's not it's not something that's nice to contend with. Give it a lot of time. I would stick to meat. I would stick to red meat. Red meat always does better than any other meats, even eggs. If you're getting eggs from pasture raised chickens, that's going to be much better. But even then, I can say they're pasture raised and just have access to pasture, but never go out there and just be just eating a bunch of feed. But if you're just eating a lot of red meat, then that's going to be the best you can. Give it 3 months. I think that's great. Eat enough fatty red meat and try to eliminate everything else out, and hopefully you're one of these people who can improve their sarcoidosis. I really hope so. And if you do, let us know. We need more people like yourself letting us know how you're going. We need more and more people. And in fact, people here, please go into the comments. Let people know. Let me know what your experience has been on a carnivore diet. What issues you've had that maybe have gotten better. Maybe things have gotten worse. Tell me how you're doing. It's important to see these things and get more of an impression about what's going on, and for other people to see as well. And if you're just seeing person after person after person after person saying, I had this and this fixed it, I had this and this fixed it, I had this and this fixed it, and they go like, wow, that's my problem. And I just saw 50 people comment individually that they had that exact issue and it got better. Okay, well, that's going to give me enough courage to give this a try myself. And so please do. If you guys can just leave a comment on the chat, live chat's great, but in the actual major comments that stay around so that people can see them watching the replay, please do that. And so other people can see. So talk about your issues. These were my issues. This is how they changed. And that's very important for people to see so that they can get an idea if this is right for them to try. Question from Chris. Thank you very much for the super chat, Chris. I appreciate it. Hi, Chris. Hi, doctor. I want to try the lion diet, but I'm scared that it will make me fat. It's not going to make you fat. 100% not going to make you fat. I weigh 178 pounds, female. My next goal, if I don't lose weight, I plan on going to Mexico to get a gastric sleeve since I don't qualify here. Okay. I would really, really, really try to avoid a gastric sleeve if you can. They can lead to very serious complications and problems immediately, but also down the road. And you can get serious absorption issues, malabsorption issues. You may have to be taking, get iron transfusions and B12 shots for the rest of your life. And the rest of it's going to be difficult as well. You can get strictures that can cause it so you just vomit profusely anytime you eat anything, because no food can pass through. You have to get another surgery to cut out all the scar tissue and do all this sort of stuff. It's not great. It can help people, but it does not come without a cost financially, but more to the point, physically and for to your health. It really, really makes a big difference, and it can really harm you. I would go Lion Diet. You have to understand that people have hormonal issues, and depending on where they're coming from, you can have, and you can get some blood tests. You can take a look at this. You check your thyroid, check your TSH, free T3, free T4, and your reverse T3, and also check your leptin, leptin, your fasting insulin, your HbA1c. All of these things matter when you're talking about weight loss, because it's not about calories in, calories out. This is hormonal largely, and yes, the amount of things that you put in your body, has an effect on your body, but it's more importantly has an effect on your hormones and what your body does with those nutrients, right? So that's very important. And eating a carnivore diet, especially a lion diet, and getting enough fat will raise your metabolism, will make you lose fat. You might actually not lose all that much weight at first, because you can put on healthy weight like muscle, like bone density, which will offset the weight, the number on the scale, because you're losing fat, but you're also gaining muscle. You're gaining healthy weight, you're losing unhealthy weight, and losing water weight as well. And so that's something you need to remember. Also remember that if your leptin is very high, then it's going to be much more difficult for you to lose weight at first. But on a carnivore diet, your leptin will come down. So will your insulin. So will your HbA1c. And your thyroid will improve as well. And so if your thyroid's low and your leptin's high, you're going to have a difficult time losing weight at first. But stay with it. You will get better. You will feel better. So this is why I tell people to focus on how they feel, on their health first, because that's really what's important. That's what's most important. The weight will come. It will happen. You need to be strict. You need to be really just red meat and water. Eat fatty meat until it stops tasting good. Focus on your health, and you need to let those hormonal levels come back down into a normal range, and your other ones to come up into a normal range. So it's a big balancing act in your body. It's very important to get that, to give your body the right inputs. You're going to get the right outputs, but it can take time. And so some people, very few people though, like small proportion, small percentage, will actually put on a bit of weight. It's not because fat makes you fat, or you're just, you're eating too much. All these, no, it's because you're hormonally out of balance. Your metabolism is suppressed and has been suppressed for years because of dieting and restricting and eating the wrong things. When you're eating enough meat, when you're eating enough fat, when you're giving your body what it wants, now you're signaling, say, hey, we're not in a famine anymore. We have enough. Okay, you don't need to hunker down and store this energy. When you're under eating, your body thinks we don't have proper resources. We can't use this energy. We can't use these resources. We need to slow down the metabolism, or we're going to die. We're going to run out of resources and we're going to die. That's the rule of life and death in the animal kingdom, is that you run out of resources, you die. And so if you can't contend with a famine, if you can't contend with going a week, 2 weeks, 3 weeks without eating, you're going to die. Your species will die out. Our species did not die out. Okay, so we contended with that. We're very well adapted to that. So the less you eat, the slower your metabolism is going to go. Eventually, you're going to lose weight. It worked in Auschwitz. Okay, that doesn't mean that it was healthy. It doesn't mean it was good for you, and it doesn't mean that it was good for your metabolism. It doesn't mean that it increased your metabolism. And when you start eating again, bam, you'll slam on weight. Why? Because your metabolism is low, and your body's like, okay, get this in there. We need to store this. Okay, because we're in a famine, and we may not be able to eat again, for another 3 weeks. So eat enough meat. Eat until fatty meat stops tasting good, and you will signal your brain and your body that you are in a time of abundance, and you can ramp up your metabolism, and your insulin will go down. Insulin down, metabolism up. Insulin up, metabolism down, right? And then leptin. Leptin is very, very important. It controls insulin interferes with a lot of different hormones. So does leptin. And so it's very important. And insulin actually interferes with leptin. And so it's very important to give your body time to recover from these things, and it will on a carnivore diet. So give it time. Watch Kelly Hogan. She experienced this where she actually put on a bit of weight over the course of 6 months, and then just something changed. Her hormones got back into a good working order, and just the fat just came off of her, and she's been very slender ever since. And she's never had a problem with her weight after that. So that's what I would do. I would strongly suggest that you try to avoid gastric sleeve really at all costs, and you will lose weight on a lion diet. You will lose weight. You just need to do it right. You need to give your body what it needs, and you need to give it time. If you want to check your leptin, you want to check your insulin, fasting insulin, your HbA1c, your thyroid, your estrogen, progesterone, and androgens and things like that. They can all be out of whack. Check it. Check your leptin. If that's sky high, if that's, it should be between 4 and 6. If that's above 100, it's going to be very difficult for you to lose weight. And some people will say that if your leptin's above 100, you have to get surgery. You don't have to get surgery. I've seen a ton of people in my practice, several people with leptin well above 100, that they do lose weight, maybe not as much initially, but the leptin comes down, and we track this, and it's coming down, and eventually it gets down to a more normal range, and that's when the weight starts coming off. So you can check that, and you can just get an idea. And if your leptin's high, well, it's going to be a bit more stubborn. But I've also seen people with very high leptins that just dump off weight as well. So it just depends. There's a lot of other things going on there as well. And so, and almost all of them are hormonal. And so just eat the meat that you're supposed to eat the things that you're supposed to eat, like a lion diet, and let your body get on with it. And you will find that you get good results, and just stick with it. And we're here for you. You join communities. There's different carnivore communities. There's different challenges that I do and other people do. But you don't need to pay for anything. There are Facebook groups that are free that you can just ask people and say, hey, has anyone dealt with this before? They have. There's nothing new under the sun. There's nothing that you're going through that someone else hasn't gone through already. And you can ask them, and they can help with that. Really good ones are Zeroing In on Health and Zero Carb Health. Those have been my two favorites for the last several years, because I think they're very well run, and they're very strict. They're not messing around. It's just like, hey, here's the rules. This is how we do it. If you want to do something else, you can do it, but do it in another group. And I like that. I think that's important. It makes it very clear for people what they can and can't do, and how they're going to benefit the most. And if you want to do more, loose carnivore diet, fine. But, some people really do need to be very strict. And so those are the groups that you want to go to if you're in that category. Forks, Washington Carnivore, thank you very much for the super chat. Forks is cool. I actually went hiking out there, did a hike up and down the Olympic Peninsula back when I was a teenager. It was gorgeous. It was amazing. Still had some old growth forest out there. It's only temperate rainforest in the world on that little area by Forks. It's a gorgeous part of the world. AD, minimal change. I'm thinking nephrotic syndrome. Oh, autosomal dominant, minimal change, nephrotic syndrome, remission didn't stick. I'll be back on 80 milligrams of prednisone a day, around 2. How much meat in a 24-hour period? Dumping over 15K protein, albumin 2.7, neph was 5 grams a day. Well, I would just listen to his body. On the bit of a fly in the ointment is the prednisone, or in other parts of the world, prednisolone. Basically the same stuff. It's a steroid. It's very strong. It's suppresses the immune system. On a carnivore diet, it's not just about eating meat, but eating meat is good for you, but you want to avoid all the other things, especially things that are going to cause more inflammation. So you really just need to be on just a meat and water diet only. That's what I would suggest. How much meat in a 24-hour period? How much does he want? How much is his body asking him for? Prednisone is going to increase your appetite. It's going to increase the amount of food that your body wants. You're going to start having cravings, things like that. 80 is a big dose. And so, he's going to be more hungry during that period. I would still probably try to listen to his body. Everyone has a different demand on how much fat and meat. If you're having, depending on his size. Okay, put it in context. Me, I'm at a stable body fat percentage, so I don't really go far up and down. I'm not working out all that much, so I'm just pretty sedentary, and I eat about 2 pounds of fatty ribeye a day, usually, but not always. But that's usually sort of an average. So I'm 6'3", 240 pounds, and yeah, between 235 and 240, some around there. And so that's how much I eat to just maintain that. Okay. So depending on how tall or heavy he is and how much lean body mass he has, you can sort of adjust there. But it's hard. It's going to be a bit more difficult because of the prednisone. But hopefully that's not going to be, that's just sort of getting him out of an acute period, and then he can sort of get back to normal life after that. But I would still just try to eat, as much meat as his body's asking him for. If he's getting enough fat, it's not going to damage his kidneys. And if he's not eating all the other things, he's not going to be bringing in nephrotoxic sort of things like oxalates and other sorts of problems. So yeah, I don't know how much. I don't know if he's doing carnivore or just thinking about trying carnivore. But try for if you're just a normal sized man, try for pound and a half, 2 pounds of ribeye a day. See how you go with that, and then sort of adjust as needed. It's hard to say with the prednisone, but normally you can just eat until fatty meat stops tasting good. And you can certainly benefit by doing that in the short term anyway, because at least that's going to help reduce inflammation by just not eating all the other things. And hopefully that will get him better to the point that he can come off the medications, and then he can just eat what his body's asking him to eat, and that might change from there. So good luck with that. I'm very sorry that he's going through that. That's a nasty situation. Hopefully that gets better. Thank you for the super chat. Quick scope. Hey, Dr. Chaffee, just wanted to thank you for all that you do. My question is your thoughts on creatine, and is BHA a safe ingredient in bacon grease? So creatine, it depends on what you're doing. I mean, if you're trying to work out and you're bodybuilding or something like that, a lot of people swear by creatine. You do get a lot of creatine in meat, especially red meat. There's a ton of creatine in red meat, and so you'll get a ton, and so if you're someone who's bodybuilding or something like that, you can see if adding a bit more exogenous creatine is beneficial on top of eating a lot of red meat, and if it is, great. Sometimes it can just increase the amount of water retention in your muscles, though. So my biochemistry professor, back in the day, he didn't think that this was actually putting on lean body mass. He thought he was just filling up the water in your muscle cells and just giving you soggy muscles that put on water weight, but then you come off of it and the weight goes away, and so you're really just losing water weight in that instance. And so, did you really have anything beneficial in the first place? Some people think that it gives them a better workout, that they can work harder, they can push themselves better, they can push through stick point where you're pushing, you sort of get stuck, and then you get going again. That can help with that they feel better on that. I never noticed too much of a difference when I took it back in the day, and I haven't really bothered with it now. I don't really work out all that much. I don't have time to work out that much. If I sort of got back into working out regularly, maybe I might try a bit of creatine just to see if that, what that did for me, if that made like a big difference or not. But, it never really made a big difference for me, when I was younger and I tried it, and I don't think I need it. I think that there is just a ton of creatine in red meat in particular, and that's really all I eat. And so I'm getting a lot of creatine anyway, certainly a lot more than I would otherwise. Um, so that's the main thing. As far as BHA is concerned, um, it's not something I know all that much about. But anytime you're getting these additives that just don't exist in plants, I mean, or just don't exist in nature, and don't exist in the meat that you're supposed to eat. I think it's never really a good idea. Even if these things are, like on the FDA, grass things are generally regarded as safe or recognized as safe. Who the hell knows that? That, first of all, that's not the FDA doing that. That's private. It's like, that's the industry. They actually tell the FDA, oh yeah, these things are all grass. It's like, no, that's like a fox in the hen house. Saying, "Oh no, everything's fine." Like the fox is the guard on the hen house. That's not going to go well. And so I don't know exactly what that's going to do, good or bad for you, but it's probably not going to be great for you. It's not something that we're supposed to have in our bodies. So I just don't want to put it in my body. So if you're, if your BHA that you're talking about is what I'm thinking of, then this is an additive. This is a synthetic additive. That can go in as as a preservative and things like that I don't think you should have. And so I try to, with processed meats and things like that, I try to avoid anything that's going to have any of these additives and preservatives, and just try to eat as clean as possible. I think just eating whole meats is the best thing you can do. This is why I don't often do bacon, but more often I'll do pork belly that doesn't have any additives. It's just the meat. You can salt that, cure that, smoke that all you want, and make your own bacon that way. But not have all the additives. Or you can get, it's like Pedersen's Farms. I met the guy from Pedersen Farms, a really nice guy. He had me on his podcast, and they do sugar-free, natural cure bacon, all that sort of stuff. Don't put all this crap in it. And so you can get things like that. I think Hempler's does that as well in the States. That's where I used to get up in Washington State, and I'm pretty sure they don't use any of that crap. So I would avoid all that stuff. I would avoid that stuff like the plague, and just eat just normal whole meats and not get anything with all the additives. Yeah. Just saw this one here from a question from Benny the Boomin. Any thoughts on how carnivore affects cortisol levels in those under stress? Mom of 3 little boys in my mid 40s. I've always thought carbs help cortisol to not go too high. I'm carnivore for 11 days. So I just did a very large, long episode on this with Richard Smith that just came out yesterday, actually. So you can go check that out. It's all about, just go, is ketosis harming you, or is it harmful? Short answer is no, I don't think it is. The evidence suggests that, being on a ketogenic diet long-term actually lowers cortisol or keeps it the same, and actually ameliorates the symptoms of hypercortisolism. So, having high cortisol, if that's causing problems, people on ketogenic diets actually improve their symptoms, even if their cortisol stays the same. So that's fantastic. The stress levels that people experience are generally quite a lot less. I don't get as stressed out. I don't get nearly as stressed out as I used to eating any other ways. I'm much more calm. A lot of people call it carnivore zen. There's even a Facebook group by that name, and that just people just get very, very chilled out, just very relaxed. Things just don't bother them. You can still get upset. Things can still bother you, but you're not just as agitated and freaking out all the time that you might be otherwise, or that other people find that they experience. So you'll find that your tolerance for little stupid things is much better. You don't care as much. Everything's better. Everything's fine. And if you want the full in-depth answer on cortisol and everything like that, and ketosis, watch that episode. Another point that someone made that I should have brought up on that talk which is, something that Professor Bart Kay talks about, which is that, if you eat a large bolus of protein, like a big steak, you're going to transiently raise your blood sugar a little bit. That's going to bring up your insulin a little bit. That's going to kick you out of ketosis temporarily. And then doing that sort of every day or every few days or whatever, whenever you eat, because, animals don't necessarily eat every day, that's going to be enough to moderate all those sorts of things. So that's something to think about as well. Is like, on a carnivore diet, are you really in ketosis all the time? Probably not. I have no idea, what my ketones are or what my blood sugar level is or anything like that, because I don't care. I'm working off the supposition that humans are carnivores, and as carnivores, um, that as carnivores, we're eating what we're supposed to eat. And if you're eating meat, you're eating what you're supposed to eat. Your body's going to do what it's supposed to do. So I just let my body get on with it. If I'm in ketosis 24/7, fine. It seems to be working so far. If I'm not, and it's going in and out of it, also fine. Whatever my body's doing, it's supposed to be doing it, and I'm happy with that. But yeah, I had meant to mention that in that talk, but we were specifically sort of addressing question or the issues of the different studies in that Mercola interview with Georgie Dinkoff, who's a really nice guy, by the way. I did a debate with him. People can watch that debate on Brian Grin's podcast. Very nice guy, very knowledgeable, very smart guy. So obviously, it's something that we need to think about and we need to talk about. But I don't think there's a problem there. And also, you may just not be in ketosis all the time, and that may be just problem solved right there. Question from Holly Ruth. Thank you very much for the super chat. What do you think of supplements Bart K recommends? Cerule. I have rheumatoid arthritis, very inflamed, carnivore for 5 months with some relief. So for rheumatoid arthritis, I think you just need to be strict red meat and water, and just only red meat and water. And you'll get the best results from that. Get rid of all dairy, eggs, even pork, chicken, fish, things like that. And give it time. You're already getting some relief. That's great. You'll get more relief. The supplements of Professor K, I don't know enough about it. That's something that I have looked into. I have spoken to him about it. It sounds very interesting, very promising, and there's some interesting studies, showing that this sort of releases more stem cells in your body, and that they get all over your body, which is great. That's what I want. I was interested in trying them first and wanted to see if that helped, like my knee in particular, because I have damaged cartilage in my patella. The rest of the knee's fine. It's just the stupid kneecaps from kickboxing since I was a kid and doing knee strikes. So unfortunately, that damaged the cartilage, and that just sort of got worse and worse as I got older and kept playing contact sports and things like that. So jury's out for me. It's not. I generally just I try to sort of stick my message to just being, hey, just eat meat, be healthy. And that's all you need to do. Could this help? It certainly could. It certainly suggests that by the by the preliminary sort of data that's out there. But it's something that I wanted to look in a lot more closely and try it myself and see what I thought on if that would help me. And before I sort of were to recommend that to other people. So that's something I haven't really done yet. As far I've read some of the studies and they're all very promising, but as far as trying it myself, I haven't really done that yet. So that's something I'm still sort of thinking about. But I think it's very promising. But I think for yourself with rheumatoid arthritis, I think that the main thing for you is getting away from all these other things. They're going to be triggering off your rheumatoid arthritis. So that's what you need to do the most, is stay away from plants, sugar, alcohol, and even pork, dairy, chicken, fish, eggs, and things like that. You go just strict red meat and water, especially grass-fed, grass-finished red meat and water. I think that your rheumatoid arthritis is going to be a thing of the past. And so I think that that's something to look forward to. So good luck with that. And okay, so let me. Sorry, I'm just gonna switch down here. I just saw this pop up. Very nice. A super sticker from Elimeli, who's my my very nice little L. Sent me a super sticker. It's very kind of you. Thank you, sweetie. She just let me know that she's watching. It's very kind of you. Okay. So next question here from Forks, Washington again. I'm the MCD question. Hubby and I were carnivore over a year and both felt amazing. And then the kidney issue came back on. We don't know what it. We know it wasn't diet. Okay. I suspect mRNA jabs, biopsy supposedly inconclusive. Very sorry to hear that. Yeah, unfortunately, there are other things besides diet that can affect this. So but this actually helps answer your last question. If you're a carnivore for a year before that, just keep eating the same amount of meat that he was eating before. He's going to have disruption. He's going to be much more hungry. He's going to want to eat a lot more because of the prednisone. Just stick around about where he was eating before, and that should see you through. And then eventually, when you're able to come off of the prednisone, that should normalize his hunger signals as well. But just still aim for about as much as he was eating before, and that should at least guide you through this issue, at least as far as how much to eat. And I hope that he gets better and there isn't any further issues and he's able to fully recover. So I'm very sorry to hear that. Question from Ben. Thank you very much for the super chat. Type 2 diabetic, A1C is 5.3. Fantastic. Since October 2021, carnivore last 9 months. Neuropathy in feet seems to be a little worse. Strange. Usually doesn't do that. Usually goes the other way. No pain, but numbness and tingling. Okay. I think I'm seeing a neurologist. Thoughts on that? It's very curious. If you're on carnivore, but you're not doing just red meat and water, what people call the lion diet, maybe try that. Make sure you're getting away from all sorts of dairy and eggs, which can be pro-inflammatory, especially those who are sensitive to it. I think the other causes of neuropathy is not necessarily just diabetic neuropathy. And if your A1C is 5.3, you really shouldn't be developing diabetic neuropathy as well. If you didn't have it before, then it would be strange that you develop that now with an HbA1c of 5.3. And so that's a bit curious. So, if you can just switch to more just red meat and water only diet, see how you go with that. Obviously, just get rid of just every confounder that you can from a diet perspective, and at least eliminate that. See how you go. Give it a couple months. If it starts getting better, great. You can't reverse all nerve damage or anything, especially nerve damage is very, very stubborn. But it shouldn't really be getting worse. Certainly not from a diabetes standpoint. If you're not really diabetic, if your A1C is 5.3 and you're not really on medications or all these sorts of things, like for all intents and purposes, you're really not diabetic, right? Maybe go back there again if you start eating the wrong way, but at the moment, for all practical purposes, you're fine, and that's not going to be causing the damage and neurological damage that you'll find in diabetes if your A1C is normal and your insulin's normal and all that sort of stuff. If you're doing that and everything's staying normal and things are starting to get worse, that's something you would want to see a doctor about, absolutely. And there are other things that can be at play here as well. I mean, it can be sort of physical issues. You can have sort of little points of nerve compression and things like that. Usually that's one-sided versus two-sided, but you never know. So if there's a concern, if you're just doing straight red meat and water, nothing else, and this problem's starting to get a bit worse, just go and get it checked out. There's nothing, there are other things besides your diet that can affect these sorts of things. But that is a bit curious, and so just keep an eye on it, and if it gets worse, then I would get it checked out. Ciao Rosa, thank you very much for the super chat. Do high-level athletes on carnivore need carbs for energy? 2 training sessions a day, 5 days a week. Any thoughts? Shout out from Brazil. Well, hello, Brazil. No. Well, I'll put that another way. Yes, you do need carbs. No, you don't need to eat carbs. You make carbs. You make all the blood sugar, liver glycogen, and muscle glycogen you need in the proportion you need it when you need it if you're on a carnivore diet. And so, yes, you'll need some carbohydrates. Your body makes them. Your body makes them just fine. It was thought previously, there's a guy, Vince Carano, who's the iron guru, very smart guy. He basically had people do just carnivore. You're just eating meat and eggs, and that's it. Getting rid of all dairy, all that sort of stuff when you're cutting. And he was saying, oh, but you have to eat carbs sort of every, 4, 5, 6 days, sort of once a week. You just got to eat some carbs and load up. That's because you run out of your liver glycogen and you have to eat carbs to replenish that. That's incorrect. You don't need to eat any carbs. That was what was thought previously. That's not true. That has been shown biochemically. That was in my biochemistry textbook 23 years ago. 20 years ago. Well, anyway, 2 decades at least. So, that is something that we know happens. And there's actually a study in wolves back in 1981 that looked at that because they said, oh, well, you need carbs to burn carbs, right? You have to eat all these carbs to get glycogen and blood sugar and all that sort of stuff. But, wolves don't carbo load before they chase caribou for 10 hours. Do they have blood sugar? Do they have liver glycogen? And they found out, yes, they do. And it's rock solid. It does not change. They don't need to carbo load to build it up and then smash it down, then eat a whole bunch of carbs and then smash it down. It just stays here. It's right here because they replenish their glycogen stores from their fat tissue constantly. So no matter what they were doing, their glycogen was right there. And that's what you find in human athletes as well, is that, if you are eating what you're supposed to eat, your body will work the way it's supposed to work, and your body is supposed to have glycogen and blood sugar and all these sorts of things. And so you'll do great. So, me as an athlete, I have never performed better, never had better energy, never had better explosive energy that I could sustain for longer than when doing a carnivore diet. It is absolutely night and day difference. It is not even a little bit similar. If it wasn't for that arthritis in my knee, I would be playing rugby right now, and I am really upset that I can't. But who knows? Maybe I'll be able to rehab that thing. It's just anytime I sprint or anything like that, like I can still lift weights, I still do cycling. I can do hills for some damn reason. If I run on a flat, my knee will swell up for 3 weeks, and it's just really obnoxious. So, I'm still trying to rehab that. I'm doing sort of the knees over toes guy routine, and that's been helping in a lot of ways. I haven't tested it out on like a run or a jog yet, but I just want to get my knees just rock solid, and then give it a shot and see how it goes. And if it keeps swelling up, I think what my tactic is going to be is just running hills, running stairs, and doing like the stationary bike, because I can for some reason do that and get my fitness that way. And then just like every now and then, have like some sort of game and just go out there and just smash a bunch of people, have a lot of fun, and then just not walk for 3 weeks. And then, 6 months later, do it again, and just maybe just do that with some of these like invitational games that, some of my good friends that I grew up playing with, they sort of play in every now and then. And, maybe I can get my fix that way. But, but as far as training with energy is concerned, that is not the problem. That is not the issue. That has never been better than when on a carnivore diet for me, and for many athletes that I know right now. They're doing this. They're like world-class level athletes. Look at Ryan Talbot, who's, world-class decathlete. He's an 2-time All-American, NCAA 1 All-American out of Michigan State. He won the Big Ten competition last year, came second this year. He like someone in that national circuit that he was in this year and last year. Almost certainly someone from that is going to be in the next Olympics representing the U.S. Right. And so, and he's saying he was just feeling great the whole time. He never ran out of energy on the last, 10 events. Right. Normally people are just cashing out. He said that, 3 or 4 people couldn't even finish the events at nationals. This is, coming up to the Olympic level athlete competitor, right? 3 or 4 of them couldn't finish. because they were just so gassed, so tired, so broken down from the competition. And he said that his last events were his best events because he just felt so great. So that's what this does for you. It actually makes your body work a lot better. You don't need to micromanage this stuff. You don't need to, oh, I have to think because of this car. Just let your body get on with it. The smartest thing you can do as an athlete and as a competitor is letting your body do its thing. And you don't need to try and trick and cheat and fiddle with it. It's not going to work better than millions of years of evolution. It's just not. And so that's what I would say to that. Okay, Nicole Glover, thank you very much for the super chat. Can I expect a reduction in toenail fungus with a carnivore diet? I've tried everything, in quotes. Thank you very much. So, look, it just depends. There are people that have found improvement on toenail fungus, but not everybody. Not everybody's going to. Some people do. The nail fungus is a bit of an issue because it's outside of your body. Anything in contact with your body's going to be able to fight and contend with. But if it's in the nail itself and your immune cells aren't getting there, and so it could be that they're a bit healthier and it sort of like stuffs it down and stops it from getting worse, or maybe eventually it will clear it. But it's not necessarily going to be able to make that better. But I have absolutely seen people at least say in their experience that it got better. But it's difficult because it's sort of outside the body, and your immune system doesn't really have the ability to sort of get after it, which is what you need. You need to have access to it for your body to fight it. Okay, thank you for the super chat, Kevin. So from Kevin Hansen, been on keto for 6 months. I have polymyalgia rheumatica, on prednisone daily. Hope not for long. Have you heard of PMR getting better with carnivore or keto? Yes, but these are anecdotal, right? I don't know of studies looking at that with with PMR, but a lot of things that people react to are in the plants, even non-carbohydrate ridden plants. And so getting rid of those seems to help a lot of people, and certainly reduces inflammation. You're talking about prednisone, what's that going to do? That's going to suppress inflammation. It's going to suppress your immune system. That's what ketones do. Ketones regulate your immune system and they suppress undue inflammation. That is just a product of ketones. So being in ketosis is going to help with that inflammation side of things already, and then removing out a lot of different things your body's reacting to can absolutely improve your situation as well. So I would go again, like these other people, strict red meat and water, nothing else, no dairy, eggs, or anything like that, even, because you need to be more careful. You need to get rid of everything that could possibly your body could be possibly reacting to, and just give your body the best shot that it has, and then just giving it time. These things do take time, and but I think that this will help so many people in so many ways, and it'll help you in so many other ways anyway. You'll feel a lot better in general, and so even if it doesn't specifically help that, which I think it probably will, it'll help you in so many other ways that you'll feel a lot better about having to deal with that as well. So that's what I would do. I mean, look, anything that you have to take prednisone for, there's a good chance that fixing the way you eat is going to help with that, because we shouldn't have to take prednisone. Like, that's something going wrong in our body. Something's disordered. And so, if you get your body back in order, a lot of those things can be resolved. And so it doesn't mean that everything that is treated with prednisone can be fixed with this, but I do think that a lot of things that we treat with prednisone, that's a good sign that something's going wrong in your body. There's undue inflammation and problems in your body that eating a proper diet will resolve for many people. So I would do that personally. Terry Parker, thank you for the super chat. There's not a question attached, but maybe there's one in further down. And same thing with Alan. Thank you very much, Alan. And Terry, I will look for those if they're just in the chats. And there's Terry trying again. I'm so sorry. I don't know why it does that. Why it doesn't come with the question. Here we go. round three. So Terry, I'm so sorry that that you had to do that. That's very kind of you to keep doing that. If someone does put in a super chat and it doesn't, the question doesn't come through, try putting it in the normal chat. There is a delay. I'm about sort of 30 minutes behind on these questions, so there is a bit of a delay. But if you put it in there, I will try to find it. I'm not guaranteed to see it, but I do look. So, question from Terry. Thank you very much for that. I'm sorry that it was such a pain in the ass. Are you familiar with adenovirus 36 that increases fat cells exponentially? Studies show that 70% of obese people have this virus. Is this true? That's an excellent question. I don't know, actually. I haven't come across that, but I will make a note of that and look into it. As far as 70% of people having that, is it what's causing what? Maybe they're just more susceptible to different sorts of infections and viruses and things like that. Do they always have this virus in there? And what came first? What's causing what? Or are they just correlated with something else? Is there something else going on that's precipitating both? There's another correlation that's interesting as well, which is with omega-6s. And in fact, when people are more overweight, they have more omega-6s in their adipose tissue, in their fat tissue. And so is that just because they have more fat to store more omega-6s, or is omega-6 driving the deposition of fat? We can't really use omega-6s for energy. So this is sort of shooting a hole in the whole calories in, calories out nonsense, because omega-6s are fatty acids. So that should be 9 kilocalories per gram. And yet you don't get any kilocalories per gram. You don't get anything from them because you can't use them as energy. And that's just not what those molecules are used for. So, just like wood, you eat a bunch of wood that has calories, you can burn it, works great in fires, doesn't work great in your body. So it really does matter what the chemical composition is of these molecules. So that's another one too. People get more overweight, they have more omega-6 deposition as well, by and large. And so there might be some sort of correlation there. But I'll look into that, because that's interesting. That's an interesting connection there, and I'll see what the authors of that study thought about that. Question from Epiphyllum Balcony. Thank you very much for the super chat. I have lipedema and Ehlers-Danlos. Carnivore has improved both. Lovely. Well, that's amazing. That is something I'm seeing more and more with lipedema. That's something a lot of people have a question of. Does this help with that? I don't know of any studies that are going to go one way or the other, but more and more people like yourself are showing that it is helping, which is lovely. Ehlers-Danlos, wonderful. I have seen this a number of times. It's just getting more and more convincing that this is something that can be improved by that. I have 3 patients personally who have Ehlers-Danlos and have improved dramatically on a carnivore diet. And I think that has a lot to do with the fact that they're just getting in a lot of healthy collagen. Their body doesn't have to make it themselves. So Ehlers-Danlos is a collagen, basically improperly making collagen. And so you don't have proper collagen, you have weak connective tissue, you get hyperreflexive joints, really stretchy skin, things like that. And it can cause very serious problems, and joint dysfunction and other sorts of things as well, even more major serious issues than that. But it seems that when people go on a carnivore diet and are just eating a lot more meat in general, they're getting in a lot more collagen, and it might be that your body's just using that collagen and those building blocks to make better collagen than having to make it all from scratch, because you don't have enough resources. And if that's the case, then that's improving. And so I have a number of patients, so those 3 patients that I see in the clinic, and then a number of people online like yourself who have improved dramatically. One gentleman was having dislocations. His joint was basically, he'd fall asleep, he'd wake up, something would be out of place, like basically every time he woke up. And so small joints, big joints, all these sorts of things. And then all of a sudden, he's not having any dislocations anymore, which is amazing. So, a lot of people are improving from that. So I'm really glad to see that you are as well. Question from Santiago. Thank you very much for the super chat, Santiago A. Hello, today I just started. I'm 18 years old and my family thinks I'm crazy for doing this. What are the pros and cons? And what about cholesterol being a con? Thanks. So, well, good for you for giving it a try and, starting out. Well, that's a good question. What are the pros that made you want to do it? Think about that. Think about the things that other people are doing that made you interested in this in the first place. And you sort of, pick at those things. One of the first videos I did was just called "The Facts About Carnivore and Vegan Diets," and that just goes into the details of why it's a good idea to eat meat and why just eating plants is not a great idea, and certainly why it's not the optimal thing for us to do. So that has a lot of the pros and cons, and I addressed the cholesterol thing in there as well. Basically, cholesterol we've just been misled about why. That we should be concerned about it. I don't think we should be all that concerned about it. I think we should be concerned in certain circumstances, but I don't think that it's a direct cause of heart disease. I just don't. And if it is, it's the small, dense, damaged pattern B lipoproteins that are a problem. Having too low HDL, too high triglycerides, and pattern B LDL cholesterol, that is more indicative of developing a problem. But is that the direct cause of the problem, or is something else that's causing that dyslipidemia also causing damage to your artery walls and heart disease? So that's a question that we don't have an answer for. But I think that the evidence is very clear that just higher LDL cholesterol does not cause heart disease. In fact, there are studies that show the opposite. The Framingham study showed that. They showed lower cholesterol actually equated to higher cardiovascular disease and death, and there are many, many more studies. So there's another lecture that I have on my podcast, on my website, my podcast, or my YouTube channel, and my podcast, called "The Truth About Cholesterol and Heart Disease." And that goes into a lot of the data, basically showing that we were misled. It was industry research funded by the sugar companies, which they did not disclose, saying that cholesterol caused heart disease, and blaming fat when it was really sugar or seed oils or a combination of the two. But it certainly wasn't saturated fat. It certainly wasn't our healthy natural cholesterol. And Ansel Keys was one of these paid shills. There were a number of Harvard professors that were paid shills. The McGovern report, that came out. That was the guy who pushed that, was a Seventh-day Adventist who's anti-meat, anti all that sort of stuff. So this is just brimming with corruption, and so we cannot trust any of those things. And so I think better data, better literature shows that actually cholesterol is good for you. Study with over 11 million people showing over the age of 65, showing that higher LDL cholesterol, any LDL cholesterol, whether you had pattern A or pattern B, it didn't matter. They didn't look at that. Just higher LDL cholesterol equated with lower all-cause mortality. You lived longer if you had higher LDL cholesterol. So, what are we doing here? And there's many, many more things as well. So I would look at those two: the facts about carnivore diets and heart disease, facts about carnivore and vegan diets, and the truth about cholesterol and heart disease. And that should hopefully answer questions enough for you, and maybe get your folks off your back. But I think that I think that you'll do very, very well. And if I thought that this was harming people, I would not be out here talking about it. And if I see something that significantly changes my mind, I will absolutely tell you guys about it. But so far, everything I see just makes me more and more, satisfied and happy with that conclusion that this is not the problem that they told us it was. Question from Mike Hoffman. Thank you very much for the super chat. 6.5 months carnivore. At 3.5 months, blood pressure went down from 140/85 to 120/65. That's great. And heart rate went from 85 down to 65. Great. But at 4.5 months, it all went up again, worse than before, and it's still there. How come? Well, that's a good question. I mean, there's a lot of different things that can be at play there. Just normal stress, daily stressors will affect both of those things, and being worried about it and sort of stressed about it will just automatically do that. So I would definitely de-stress. Sleep is very important. If you're not getting proper sleep, then you're going to stress yourself out. You can raise your cortisol. You can reduce your melatonin. Melatonin suppresses cortisol, so you don't have enough melatonin. You're going to have too much, potentially too much cortisol. When people get prescribed melatonin at higher doses, you have to check your cortisol because it can suppress your cortisol, and you can sort of be groggy in the morning. That's not because you have a drug hangover effect. It's because you've suppressed your morning cortisol, so you don't wake up as well. And so that's what I would. Fix your sleep, fix your stress, make sure you're just on red meat and water, because again, you have to go back to baseline. If you're ever having sort of problems, make sure you're eliminating out something that could be a problem. If you're having, pork, chicken, fish, especially farm fish, farm fish really, then this can be high in linoleic acid, omega-6s. This can cause disruption and problems throughout your body, and you can have issues of this nature by eating those sorts of things. So go to red meat and water, improve your sleep, get a sleep mask, maybe turn off the lights an hour before you go to bed, hour before you want to be asleep, get away from screens, phones, everything like that, computers, TVs, and you even take a small dose of melatonin, put on a sleep mask, optimize your sleep, optimize your stress, do some deep breathing routines throughout the day, de-stress, chill out, some cold exposure in the morning, get outside, get some light, get sun exposure, things like that. Very important. UVA is very important for cardiovascular health. Crazy enough, UVB, you get more vitamin D and things like that as well. So it's important to get out in the sun. It's important to get that sun in your eyes. Okay. And so optimize those things that you can optimize, and then see how you go. And I would expect that it improves after that. And if not, you can go have a chat with your doctor. If you have other sorts of symptoms, you can see, hey, maybe is there something going on? Heart rate of 85 is nothing to worry about. I'd probably around the same. Blood pressure around 140. Our levels keep going lower and lower and lower. A lot of people are arguing that that's because the drug companies that are trying to sell us this blood pressure medication are trying to lower that threshold so that more people qualify for blood pressure lowering medications. So I wouldn't be overly concerned before you optimize all these sorts of things, and then maybe see your doctor if that's still persisting, and maybe there's something underlying that could be going on. But that's not out of control, bad, or anything like that at this point anyway. So I would just not worry too much. Just take it easy, and just see how you go with those adjustments, and I'm sure you'll be fine. Okay, just scroll down here. Ooh, come on. Okay, super chat from Tomaz. What do you think about pancreatic insufficiency on a carnivore diet? I use Creon pills with everything I eat. Otherwise, it's a digestion mess. Yeah, look, if you have actual diagnosed pancreatic insufficiency, then you just have to take that sort of stuff. It could be that on a carnivore diet you improve, and hopefully you do, and maybe you don't need this as much in the future. That would be great. It's just a matter if your pancreas can improve enough and recover enough that you can sort of run independently. It's not certain that it will. But yeah, I would definitely still keep using those. You have a diagnosed issue. You need to do that. There's some people that say, oh, do I need to take this stuff just on a normal carnivore diet? No, you don't. If you don't have pancreatic insufficiency, then you don't need to take anything for it. So there's nothing special that you need to do. There's nothing extra that you need to do. Carnivore diet is going to be more bioavailable. It's going to be easier for your body to digest and absorb it. And so, that's you're going to be better off in general. But yeah, you probably need to still use your medications for that. And but could be that your pancreas sort of recovers enough later on, and I hope it does. Hopefully it does. But until such time, just keep using that. Okay, so just coming up to the last couple super chats here, and then I think I'll sign off because we're going again pushing another 3 hours. So thank you everyone who stuck through that. That's great. Hopefully this has answered a lot of people's questions. Super chat from Phil. Thank you very much, Phil. Will a carnivorous diet cure lymphedema? Well, as we saw from our previous chat earlier, it can. There are people that are reversing lymphedema, and I don't know of studies that can prove that. So this is all anecdotal. So take that for what you will, but there are people who have improved it and who are continuing to improve it, and so that's the main thing. Is that it's not completely, it's not like, I've lost a leg in in a war. Is that going to grow it back? No, it's not going to grow it back. There's certain things that we can just say no. The other ones are sort of a gray area. We don't know one way or the other, but there are people that are improving. And so that's great. So, it's definitely worth a try. And will improve in so many other ways as well, that even if it doesn't touch that, you'll still be much happier for it. And again, there are people improving. So hopefully it does for you as well. Again, be strict. Fatty red meat, water, eat to satiety, eat until fatty red meat stops tasting good. Don't eat anything else. That's how you'll get the best results. Super chat from Kevin Hansen. Thank you very much for that. Thanks for answering my question about PMR. I cut out dairy already. I'm going to transition to red meat and water, and the reversed videos were awesome. Well, that's good. I'm glad you liked those. Those were for people who don't know, that was a reversed TV series on a carnivore diet. So we were reversing people's diseases and issues with the carnivore diet. We were down in Costa Rica talking to them, and we had a huge panel of experts, which was amazing. It was so great to see everybody. There was Dr. Kiltz, Dr. Berry, Dr. Ovadia, Dr. Tony Hampton, and Coach Bronson, Bella Steak and Butter Gal, Emily, who's one of Carnivore coaches, and Christ, I'm forgetting people. This is I hate it when this happens. Oh, damn it. Anyway, there was there were other people as well who were wonderful. It was really great to see everybody there, and to hang out with everyone, and everyone just hung out and just picked each other's brains and chatted about a bunch of very interesting things. And the most important thing is that the patients that we had there were helped dramatically. One lady who's very, very slender, very slim lady from Canada, she had an HbA1c of like 13.8 or 13.6 or something like that, something astronomical. And going on a carnivore diet after 3 months, it came down to, it was like 4.6 or something like that. Absolutely crazy. That doesn't happen unless you're doing something right. So people heretofore would have thought that's impossible. You would not be able to do that at all. Let alone without massive amounts of medications and things like that. Certainly not with diet alone. This is what's happening. And so what does that mean? That means something that we're eating is causing that thing, and you're eliminating that out. You're only putting what you want in your body. Problem goes away. That means that the problem is dietary related, metabolic related. We're eating something that's damaging us. We're getting damaged. You remove that and you just put in positive stimuli, and then you improve. And that's exactly what we're seeing. That's exactly what people are getting. So that's great. Just cutting out dairy already and just going to just red meat and water. I think that's the right thing to do. I think that's going to give you the best chance at your body recovering, or at least helping yourself out as much as you can. And so, that's a very positive thing to do. And then, you can always go from there if that's not enough, and see what else needs to be done. Yeah. So hopefully that works. But yeah, people with those sorts of issues, you really do just need to be as strict as possible, and hopefully that will get you where you need to go. Okay. So I just saw this comment from Copper's Kitchen. Anthony, you just want to smash someone every 40 yards again. Yeah, or less. I don't need to run 40 yards to smash somebody. Happy to smash somebody is just running 5 yards. That's totally fine. But yes, I would love to do that. That would be I would love to play rugby again. That was a major passion of mine for my late teens and entire adult life. That was my life. for most of my life, and so that was very hard. It's been very hard to not have that anymore. But just a social aspect too. These are all my friends and family. Like, I've never been closer to people in my my daily sort of life and friendship than the people that I played rugby with. That's who you sort of fight and die with, on the rugby field, and then any sort of sports, and you know uh, you're going to get very, very close with people. It's the tight camaraderie. So that's been difficult, but yeah, there's a couple. I'll just sort of click through some of these things before we finish up. But question from Nancy Chandler: what are your thoughts about reversing ADHD and depression? So that's the work of Dr. Chris Palmer. He's actually doing that with ketogenic diets and metabolic, um, metabolic interventions and things like that, improving people's metabolism, improving their mitochondria, and improving their ADHD and depression, schizophrenia, OCD, bipolar, and autism. So look for the interview I did with Professor Chris Palmer, and that we'll go into that. But it's very promising, very promising. So this is something someone was saying. Just take a look at this. Is important. Dr. Chaffee, you need UBC injection in your kneecaps. A specialist for umbilical cord blood stems since 2016. Did my 85% degeneration right hip socket and normal yearly injection due to big joint regen. We'll call my office. Oh, okay. So that's UBC injection. I'm assuming that's stem cells, UCB injections. Yeah, so there's a lot of promising work being done with stem cells. I haven't gone down that path myself, just because it's different countries have different laws on that. They can use different kinds of stem cells. There's a guy doing them down in Panama. Apparently, you can just use there's a better quality of it, better access to them, just because of the laws down there are such that you can do better. And so, it might be that something like that helps. And that's the idea with the cerule stuff that Professor K uses and promotes, is that it stimulates stem cells and it gets your stem cells going around your body and working and helping things, which is great. If it's doing that, then and doing that in an orderly fashion and helping things, then that's great too. So yeah, I think that's if I'm going to go down all the things that I can do, I'll try to rehab it as much as possible. And then if stem cells seem to be doing more and more interesting things, then I'm probably going to I'll probably go down that path at some point anyway, if I can't get it sorted out any other way. But yeah, and someone said congratulations on 150,000 followers. Thank you very much. Yeah, that sort of just ticked over last night, so that's kind of fun. So it's great. I just really appreciate all of you guys for joining in these live chats and live discussions and asking your questions and just being interested in your health and improving your health. That's the thing. Most doctors and things like that, people are just fat and lazy. They just don't want. That's bullshit. Most people are doing what they're told, and that's been the problem. It's not that they just don't listen to doctors and that's the problem. No, they are listening to doctors, and that's the problem. They need to listen to their instincts and their and the millions of years of biological evidence that we have, and so most people want to get healthy, and most people want to be healthy and not be stuck and beholden to this medical system, which I am a part of, and is so helpful and so beneficial and so just miraculous for certain things, but it's so toxic in so many other ways. And I think that it really, really, really is important for us to take control of our own health, because if we don't do that, it's not going to be done for us. There's no free lunch. No one's going to do anything for you. You need to do this yourself. And so, getting control of your own health is the number one way of living, a proper, happy, healthy life. It affects everything. And you'll save just tons of money not having to worry about doctors and medicines and hospital bills and all that sort of stuff. And it just makes a massive difference. And we don't have to be beholden to all these drug companies and interventions and things like that. You just don't. You just live your life and just be happy. You just get on with it. And you have an accident, something, God forbid, something bad happens. There are doctors and there's hospitals there to help. That's what doctors are for. That's what the medical system is for. It's not for this chronic disease nonsense. Like that stuff shouldn't exist. It didn't exist in this level 100 years ago, even 50 years ago. It's only going up. We have better interventions, better medications, better pharmaceuticals. It's getting worse. It's only getting worse. Okay, something's wrong. All right. So we address the underlying issue, which is what we're eating, what we're doing to our body. The rest will fall into place. And so, I would, yeah, I'm just happy that more and more people are coming to that and coming to just at least be interested and looking at these things and looking at what people are doing and the experiences they're having and the results that people are getting, because they're getting fantastic results. And that's what's important. And yeah, you can wait for the study to come out, or you can try to be on that cutting edge and be one of the people that the studies were on, and that other people showed, hey, look, this is something people are doing. You can do it right now. And if it works for you and it helps you and you get better and all your blood tests are getting better and your objective markers are getting better and your vitamins and minerals and nutrients are all improving, what's the problem? If you start getting worse and there's a problem, just stop. That's fine. You can always go back to what you were doing before, right? But there are millions of people now and entire civilizations, past and present, that do this, and they are much more healthy than the average person. So, I think it's worth a try, and I'm glad that more and more people are coming around to it. So this is a question from Nancy. Do you recommend a strict carnivore diet for undisclosed health issues that present themselves as possible autoimmune disorders? Yeah, I think that a strict carnivore diet, just fatty meat and water, eating to satiety, is our biologically appropriate species-specific diet. And I think that at any point, at any time, with any issue, that your species-specific diet, your biologically optimal diet, is going to be optimal for anyone. Gazelle is always good for gazelle, right? Just always. And so, gazelle is always good for lions, right? Like tuna is always good for dolphins. Krill is always good for whales that eat krill. This is just what we're designed to eat. And so, if you're having an issue, quite often those issues are because you're not eating what you're designed to eat, and our bodies aren't working the way they're designed to work. So that's what I would say to that. There's another super chat here from Chance and Maddie. Thank you very much for that. Thoughts on lean mass hyper responders? Well, that goes into the work of Dr. Dave Feldman, who's a very smart guy. I'll be meeting with him in San Diego next week when I'm down there. We'll be at the same conference, the Symposium on Metabolic Health in San Diego. And I think it's at the Wyndham Hotel or something like that. But anyway, he's done all the research on that, and he's doing more and more research on that. So that I would look up his work on that. But it generally speaking, it still goes down to exactly what we're talking about before, right then, which is regardless of how your little idiosyncrasies of your body are, you're still human. And so, you still need to eat what humans are supposed to eat. So I still think it's important for anyone in any condition to eat a biologically appropriate species-specific diet. And I think that all the best evidence shows that is a meat-heavy, high-fat diet with mostly meat, if not all meat, and very few select non-carbohydrate, sugar-ridden vegetables and things like that have as little toxins as possible. No plants at all to guarantee that you get no toxins at all. But that's sort of my thoughts. So anyway, all right. Well, thank you very much. I really appreciate it. I think we'll sort of end there. Thank you very much, everyone. I really appreciate you guys coming on. Please do hit the like button. And I should have said that at the beginning. It really helps drive this out there. The more people that like this early on and leave comments, the more that YouTube pushes this out to people to join the live. And the more people on at the live at one time, the more that pushes that out on the algorithm as well. So that really helps. That gets us out to more people. And so that's very helpful. So, please do hit the like button now. Please do leave a permanent comment in the show. And Tell me what your experience has been with carnivore diet, and how, if you had medical issues or any sort of other issues, how a carnivore diet has affected that, because that's going to help so many people. I speak to person after person after person. I look at all the comments, and wow, all these people are improving. They have the same problems I have. That made me want to try it. Now I got those improvements as well. That really helps people. So, I'm glad that people come to these and watch these and get their questions answered. I hope that helps people. But you're helping people too, just by leaving comments. You're driving the algorithm to push this out more, but you're also showing your experience that other people can look at and learn from, and think like, okay, well, maybe I'll try this and I'll try it in that way, and hopefully I get that as well. So thank you very much, everyone. Please have a very good, safe weekend, and please do like and subscribe, and send this to people that you think would benefit by it. And if anyone was kind enough to go through this and sort of get some timestamps and sort of put that in there, please God, that is so helpful. Thank you very much, everyone. I really appreciate you all, and I will see you next time.